Good morning and welcome to the Senate Committee on Commerce and Labor. Would the Secretary please call roll?
Senator Daley? Here. Senator Ellison?
Present.
Senator Flores?
Present.
Senator Lang? Here. Senator Rogish? Here. Senator Scheibel? Here. Senator Steinbeck? Here. Chair Pazina.
Present, and it makes my heart all kinds of happy that we have the entire committee in place this morning. Welcome to the members of the audience in Carson City, Las Vegas, as well as those joining our meeting online. Today we have a very, very busy day. We have a work session as well as 4 bill hearings. Before we begin, I'd like to make several housekeeping announcements. We'd like to remind everyone to please silence all of your electronic devices while in the committee room. Members of the public may provide testimony in various ways, all of which are listed on the agenda. You may also submit public comment in writing, either in addition to testifying or in the place of testifying. And if you wish to testify in person, please do sign in at the table by the door and leave a business card with the committee secretary. When testifying in person, please turn the microphones on to speak and off to listen, because we have others listening and viewing the meeting in Las Vegas as well as online. Please also state and spell your name for the record. Anyone who'd like to receive electronic notifications of scheduled bills and access to the committee's meeting materials may do so by signing up on Nellis on the legislative website. Committee members will be using their laptops to view handouts and other exhibits. Please do not view this as a sign of disrespect or inattention. With that, we are going to get started this morning with our work session. We'll start with Senate Bill 168. Mr. Ashton.
Thank you, Chair Pazina. Good morning. For the record, Patrick Ashton, Research Division, Legislative Council Bureau. As nonpartisan staff, I can neither advocate nor oppose any measures before you today. Like the Senator mentioned, we will start with Senate Bill 168 in the work session. This bill is sponsored by Senator Wynn, was heard on March 5th, and it increases the maximum quantities of usable cannabis, THC, and concentrated cannabis that a single package of certain types of adult-use cannabis products may contain. Additionally, this bill requires the Cannabis Compliance Board to adopt regulations setting forth procedures and requirements for the issuance of a hold order for cannabis or a cannabis product, and allows a board's agent only to issue such a hold order in accordance with these regulations. Amendments. So, members, attached to the bill page are 4 proposed conceptual amendments that are also summarized on the bill page. The amendments from Ms. Connor, Ms. Nave Worth, and Sala Consulting were already available as exhibits during the bill hearing on March 5th. So for the sake of time, I will skip these amendments in my remarks and instead only summarize the conceptual amendments submitted from Deep Roots Harvest after the hearing, as well as the following amendment from Senator Wynn, who proposes to revise subsection 2C of section 1 by expanding from 14 days to 30 days the time period after which an issued hold order shall be automatically terminated with certain exceptions. And next, on the second page of the work session document, items 13 through 15, the following amendments were submitted on behalf of Deep Roots Harvest, which are summarized, I already mentioned it, sorry. Define in Chapter 678A of NRS the terms label as a written or printed material affixed to or included with cannabis or a cannabis product to provide identification or other information, and packaging as the immediate consumer-facing wrapper or container in which usable cannabis or cannabis product is packaged. And revise subsection 1H of NRS 678A 450 to require any regulations adopted by the board governing packaging and labeling requirements to exclude any cannabis and cannabis products sold at wholesale other than a label or tag necessary for the functionality of any computer software used for the C2 sale tracking of cannabis as required by the board. Further, the regulations shall not mandate a cannabis establishment to include certain information on a label that is already included on the package, and revise NRS 678B to 50 to allow a cannabis establishment to eliminate duplicative labeling on cannabis products offered for sale if certain required information is already included on the packaging. Madam Chair.
Thank you so much, Mr. Ashton. Committee members, do you have any questions? Okay, I'll entertain a motion on Senate Bill 168 to amend and do pass as amended.
Move to amend and do pass.
Thank you so much. I have an amend and do pass from Senator Flores. Is there a second? Second. And a second from Senator Daly. Do we have any discussion? Senator Ellison.
Madam Chairman, I'm still trying to get through this. I'm going to vote to get this out, but I'm going to reserve my rights. Thank you.
Thank you so much, Mr. Senator Ellison. All right, all in favor, please say aye.
Aye.
Any opposed, say nay. All right, thank you. The motion carries. Please mark that this is unanimous. However, Senator Ellison has reserved his right on the floor after he has an opportunity to review. Senator Wynn will handle the floor statement. All right, Senate Bill 169. Mr. Ashton.
For the record, Patrick Ashton, Research Division, LCB. Senate Bill 169, sponsored by Senator Doniate, was heard on March 3, 2025, and for the sake of time, I will go straight to the proposed amendment by Senator Doniate. In summary, the amendment revises subsection 1 to expand the scope of this bill to include any business, professional service, or public entity that relies on scheduled appointments or reservations. It provides in subsection 2 that a provider who violates the provisions of subsection 1 has committed a violation of the Nevada Deceptive Trade Practices Act. It makes in subsection 3 conforming changes to the existing definitions, and it excludes a reservation service platform that is not the customer's contractual designee, but arranges a personal, free, and non-transferable reservation at an entity's establishment at a customer's request. And certain other conditions are outlined in item 4A through C on the work session document. Thank you, Madam Chair.
All right, thank you so much, Mr. Ashton. Committee members, do you have any questions? Okay, I'll entertain a motion on Senate Bill 169 to amend and do pass as amended. Thank you so much.
Second.
We have a motion from Senator Scheibel and a second from Vice Chair Daly. Any discussion? Okay, all in favor, say aye. Aye. Any opposed, say nay. Wonderful. Please let it be noted that this motion carries unanimously. And this moves us to the last of our work session bills this morning, which is Senate Bill 251. And Mr. Ashton, back to you.
Thank you, Chairperson. For the record, Patrick Ashton, Research Division, LCB. Senate Bill 251, sponsored by Senator Scheibel, was heard on March 10th. This bill provides for the issuances of provisional licenses instead of registering psychological assistants, interns, and trainees by the Board of Psychological Examiners. Amendments. Senator Scheibel proposes the conceptual amendment attached to the work session document. In summary, the amendment removes the provisional licensing for a psychological trainee and instead retain deleted provisions providing for the registration of such a trainee with the board. It retains deleted provisions providing for the registration of a psychological assistant or intern, in addition to the issuance of provisional licenses to qualified applicants as psychological assistant or interns. It removes provisions in Section 13, authorizing the holder of a provisional license to take the national exam and any other examination authorized by the board for full licensure as a psychologist. It removes in Section 14 the fee reduction for the issuance and renewal of an initial provisional license as a psychological intern or trainee. Instead, the board shall charge and collect not more than $250 for the initial registration as a psychological trainee, or for the initial registration or issuance of a provisional license as a psychological assistant or intern, and $150 for the renewal of a registration as a psychological trainee or for the renewal of a registration or provisional license as a psychological assistant or intern. Thank you, Madam Chair.
Thank you so much, Mr. Ashton. Committee members, do you have any questions? Okay, I'll entertain a motion on Senate Bill 251 to amend and do pass as amended.
Motion to amend and do pass. Senate Bill 251.
Thank you so much. Senator Daly, do we have a second?
Second. Excuse me, second.
A second from Senator Flores. Is there any discussion? Okay, seeing no discussion, all in favor, please say aye.
Aye.
Any opposed, say nay. All right, this motion carries unanimously. Senator Scheibel will handle the floor statement. And my apologies, on Senate Bill 169, just to go back in time a bit, Senator Doniate will handle that floor statement. And this concludes our work session. Thank you so much to our members. All right, work session concluded. It is time to move to the bill hearings. But before we proceed, I do have just a couple reminders. Pursuant to Nevada Revised Statutes 218E.085, it is unlawful for a person to knowingly misrepresent facts when testifying in a hearing before a committee. A person who knowingly misrepresents facts before a committee is guilty of a misdemeanor. We have 4 bill hearings this morning, and I'd like to ask our presenters to be as concise as possible so that we can get through these in a timely manner. Additionally, I ask the committee members to limit their questions for each bill. You can always follow up with the bill sponsors offline after the meeting. Please do ask questions. We'll just ask that you be concise. Further, I've allocated equal time for testimony and support, opposition, and neutral after each bill presentation. Also, each person providing testimony is allowed a maximum of 2 minutes. Staff will be timing each speaker to ensure that everyone is given a fair opportunity to speak. All right, so at my discretion, I'm actually going to change around the bill order this morning. So we're going to hear the bills in the following order, beginning with Senator Lang on Senate Bill 387. She'll continue with Senate Bill 292. Then we'll move to Senator Cruz Crawford with Senate Bill 327, and finally Senator Orenshaw with Senate Bill 171. I'm now going to open the hearing on Senate Bill 387. This bill revises provisions relating to the prevention and early detection of lung cancer. And Senator Lang, thank you, and begin when you're ready.
Good morning and thank you. Chair Pacina, I'm Roberta Lang, representing Senate District 7 in Clark County. Today I will present this critical piece of legislation to improve the prevention and early detection of lung cancer. With us on Zoom is Dr. Mehta, who is Director of Interventional Pulmonology at the Lung Center of Nevada and is also the Department Chair of Pulmonology at Mountain View Hospital, both in Las Vegas. Before we begin, I'd like to note that I have proposed a conceptual amendment which is available on Nellis. Lung cancer remains a significant health concern in the United States, with an estimated 226,650 new cases expected in 2025, according to the American Cancer Society. It is the second most common cancer, both in men and women, and tragically, it is a leading cause of death for cancer patients. According to the Centers for Disease Control and Prevention, in short, the CDC, early detection of lung cancer is crucial for improving survival rates. When lung cancer is found at a localized early stage, before cancer cells spread within and around the lung or other parts of the body, treatment is more effective, and there are more treatment options available. Research shows us that patients with early stage lung cancer have a high 5-year survival rate exceeding 75%, while the survival rate for stage 4 lung cancer is less than 10% in the same time span. This brings us to Senate Bill 387, requiring health insurers to cover lung cancer screening improves early detection and treatment, similar to prostate or colon cancer screenings we have already required in our statutes. Medicare, for instance, already covers annual lung cancer screening for qualified high-risk individuals. At this point, I'd like to hand it over to Dr. Mehta for additional background information.
Thank you, Senator Lang. Hope everybody can hear me okay. I will spell my name. My first name is Vishisht, V-I-S-H-I-S-H-T. My last name is Mehta, M-E-H-T-A. Thank you, Chair and members of the committee, for the opportunity to speak with you today. I am the Director of Interventional Pulmonology at the Lung Center of Nevada, Division of Comprehensive Cancer Centers, and Chair of the Pulmonary Department at Mountain View Hospital, both in Las Vegas. I do strongly support SB 387 as it has the potential to save lives by increasing access to lung cancer screening. Lung cancer screening is the leading cause of cancer-related deaths in the United States. And if found early, it can be treated and sometimes considered cured. Most cases, unfortunately, are diagnosed too late, and at that time, treatment options are limited. The best tool to fight this is low-dose CT screening, which has been proven to reduce lung cancer mortality by up to 20% in high-risk populations. For example, the survival at 2 years for stage 1A1 is 97%, and for stage 4B is 10%. So lung cancer screening shifts the stage of detection from late stage to early stage. The CAT scan or CT scans are painless, quick, involve no needles and no contrast dye. This bill will bring greater awareness to lung cancer, ensuring more patients and providers understand the importance of screening, and it will help improve access to care. As a physician, I have seen firsthand the devastating impact of late-stage lung cancer. I've also seen the benefits and power of early detection. Patients' cancer is found early, they're effectively treated, and their lives are saved. I urge you to support this. I'm here to answer questions based in my professional capacity related to the medicine and science around this condition. Thank you for hearing me.
Chair Pacino, with your permission, I'd like to summarize a conceptual amendment together with sections of the bill, as the amendment makes significant changes in the bill's current provisions. The amendment removes the new requirements concerning lung cancer screenings in sections 1, 3, 4, 6, 8 through 11. It requires commercial health insurers with policies in health insurance or health plans to provide coverage for lung cancer treatment, and also provides lung cancer screening in accordance with guidance for such screenings published by the American Cancer Society or other guidelines or reports concerning lung cancer screenings from additional recognized professional organizations, which include current or prevailing supporting scientific data. This is consistent with existing requirements in state law concerning colorectal and prostate cancer screenings, for example, in Chapter 689B of the Nevada Revised Statutes. Section 5 refers to Section 4, which I propose to amend, and therefore Section 5 will have the same requirements as set forth in conceptual amendment. Sections 2 through 10 authorize the Commissioner of Insurance to, number 1, require certain policies issued by domestic insurer for covered individuals in another state to include the amended coverage requirements, and 2, suspend or revoke the certificate of authority issued to a health maintenance organization or certain insurers that fail to comply with these screening requirements. The amendment deletes sections 9, 12, and 14 through 16, which would have established these requirements for Medicaid, Medicaid managed care organizations, and other public insurers. Further, the amendment also deletes Section 13, which would have required the governor to annually proclaim Lung Cancer Awareness Month and a Lung Cancer Screening Day. Finally, the amendment replaces references to the United States Preventative Services Task Force in Section 17 and now requires the Department of Health and Human Services to conduct a study to determine if lung cancer screening criteria adopted by the American Cancer Society creates inequities in access to screening for lung cancer based on sex or gender identity or expression, and submit a report on its conclusions and any recommendations for expanded criteria to increase access to screening for lung cancer to the Joint Interim Standing Committee of Health and Human Services. As of March 2025, no fiscal notes have been published. I'm prepared to answer questions that you might have from the committee.
Thank you so much, Senator, and thank you so much, Doctor, for the presentation. Do we have questions? And just a reminder to everyone, absolutely feel free to ask questions, but we are trying to find more brevity this morning with so many bill presentations. Senator Ellison.
Thank you, Madam Chair. This is easy and quick, I hope.
I hope.
We tell everybody that, to quit smoking as soon as they can, but apparently, according to this, it looks like it's still going to stay in your body. Is that correct, even if you quit 15, 20 years ago?
Doctor, could you answer that question?
Absolutely. The risk of lung cancer does go up with the amount of time smoked and the quantity of cigarette smoke. And if somebody quits, the risk of lung cancer is lower every day as the time goes by. But the risk of someone who's ever smoked versus who has never smoked, the ever smoker will still have higher risk.
Thank you, doctor. And can you share your name for the record one more time?
Certainly. My name is Dr. Vishisht Mehta, Vishisht Mehta.
Thank you so much. Senator Rogich.
Good morning, and thank you for bringing this bill. I have a very quick question, and perhaps the doctor can answer this. I'm curious as to why the age range of 50 to 80 years old was chosen for eligibility.
So the first study, or the first big study, was done in or published around 2013 in the New England Journal of Medicine called the NLST National Lung Screening Trial. And that's similar to the criteria they had picked at that time. It is also felt that or known that age is a risk factor for lung cancer. So the thought is that patients younger than that, we don't know for sure will benefit or not with screening. And sometimes it's thought that patients who are outside of the age range may have other medical issues that would limit them from getting lung cancer treatment. These are guidelines and just general concepts. It is, yes, seen that patients younger and older do get lung cancer. But with screening, the goal would be to offer CAT scan intervention or CAT scan testing to those at the highest risk. And that's where these numbers come from.
And we have one final question, I believe, from Senator Daley.
Thank you, Madam Chair, and thank you, Senator, for the presentation. And the amendment clears up a great many things. I think it makes it much easier to do. I just had one quick question on the amended part where you talk about in 1A guidelines published by the American Cancer Society, and I looked that up, and it matches the 50 to 80 that we just talked about. But when we go to other guidelines or reports concerning lung cancer screening, which may be published, what are those? Maybe the doctor can answer, whatever. And then how is that going to work? Is there a timeline from when those come in so insurance people have time to adjust if they're substantially different from where they're at? I just a curious logistic type of situation that insurance companies are going to have to comply with and amend to. If you can just give a little explanation there on how and when those come into implementation.
So regarding the age ranges, those are mostly the same. Sometimes there's a few differences, a few years here or there. The other main guideline that is followed is the USPSTF, United States Preventive Services Task Force. That has 50 to 80 also part of the guidelines. For the rest, I'll defer to Senator Lang.
Senator Lang, for the record, the reason we changed the amendment is because the American Cancer Society is really the guidelines that we go by mostly, but I wanted to have the other one in there just so that there would be an opportunity to see the bigger picture.
Understood. Thank you.
All right, I apologize. We actually do have one final question from Senator Steinbeck.
Thank you very much, Madam Chair. So cigarettes are obviously the number one risk factor, but I was wondering why vaping or cigars or other types of products are absent.
Doctor, did you hear that question?
Yeah. Yes, I can speak briefly to that. Most of the reason is the literature studies cigarette smoke exposure. Part of that reason also is it's easier to quantify versus, say, cigar exposure. So we know 1 pack a day. Patients can remember how often or for how many years more or less they've smoked that amount, or give or take here or there. So that's kind of where the studies were formulated. I don't believe there was vaping or much in that way, certainly, when the original study was published in 2013 or thereabouts. So that's why it almost always focuses on cigarette use, mostly to be able to quantify the exposure amounts.
Okay. Thank you so much, Senator Lang. If you feel up to it, you can step back. Otherwise, you can stay there, and we will take testimony in support of Senate Bill 387 in our physical locations. And after that, we'll move to the phones.
Good morning, Chair Pazina, Vice Chair Daly, and members of the Senate Commerce and Labor Committee. My name is Jacqueline Nguyen, Nguyen, and I represent the Nevada State Medical Association, the oldest and largest organization representing physicians in our state. Those 55 to 80 with a history of smoking or other risk factors are at a higher risk to develop lung cancer. Lung cancer is usually discovered in later stages because symptoms do not present in the earlier stages. Early detection through low-dose CT screening offers more options for medical intervention and significantly increases the chances of successful treatment. Therefore, our physician members are in support of SB 387. Thank you.
Good morning, Chair and members of the committee. My name is Dr. Siobhan Harrigal, C-H-I-V as in Violet, O-N-N-E-H-A-R-R-I-G-A-L. I'm a local radiologist who specializes in cancer imaging. I have lived and worked in Nevada for more than 10 years. I am here in support of SB 387. So why do we care about lung cancer? Because lung cancer is a big deal. As Dr. Mehta and Senator Lang have said, it is the leading cause of cancer death in men and women in Nevada. Every year, lung cancer kills more people in America than breast cancer, colon cancer, and prostate cancer. So why is lung cancer so deadly? Because it's usually found too late. It's usually found when it's an advanced stage after it has spread to multiple organs in the body, like the brain, or the bones, or the abdomen. The good news is that we now have a way to catch lung cancer sooner when it's easier to treat. This screening tool is a low-dose CT scan, and it has been shown to save lives from lung cancer by catching it sooner. Just like mammograms can catch breast cancer sooner, this low-cost, low-dose CT scan saves lives from lung cancer through earlier detection. It is an easy 5-minute test that has been shown to save lives, and it's easier than a mammogram. Lung cancer screening catches cancer sooner when the cancer is smaller, and it's easier to treat when the patient has a better chance to survive. Someone's chance to survive lung cancer is directly related to how soon we can catch it. With screening, we catch more early, small, stage 1 lung cancers. But without screening, we find more advanced, large, stage 4 lung cancers after the cancer has already spread throughout the body. Even though we have this great life-saving tool, the bad news is that lung cancer screening numbers in Nevada are terrible. Our numbers in Nevada are among the worst in America. We are trying to fix this.
We're at 2 minutes, so if you want to wrap it up, and make sure that you provide all of your comments to our secretary as well, because they're important. We want them on the record.
Absolutely. We are trying to fix this. One of the barriers our patients face is the cost to getting this test, and this would remove one barrier to people getting it. Thank you so much for your time.
Good morning, Chair Pazina and members of the committee. For the record, my name is Carrie Harrington. I'm the Executive Director with Nevada Cancer Coalition. I actually have shared my testimony already, so I won't read the entire thing. Nevada Cancer Coalition supports SB 387 in reducing barriers to lung cancer screening and diagnosis, an effort of, as you've heard, to find cancer earlier when it's easier to treat, and ultimately we're here to save lives. Nevada revised statute currently provides protection and coverage for our insured patients for evidence-based breast, cervical, colorectal, and prostate cancer screenings. So this bill would create parity for lung cancer screening in Nevada statute and improve access to this potentially life-saving cancer screening. And just to share the proclamation component, as the Nevada Cancer Coalition, we do work on that every November, and we've had a proclamation for November being Lung Cancer Awareness Month, and we work very diligently with both Drs. Mehta and Dr. Harrigal. They are our state champions in lung cancer screening to raise awareness and get more people screened. Thank you very much.
Thank you so much, and thank you so much for making time to be here today on this important legislation. And we are going to move to Las Vegas.
Good morning, Chair Pazina and members of the committee. My name is Jennifer Atlas, ATLAS, and I'm with the American Cancer Society Cancer Action Network. ACS CAN is the nonpartisan, nonprofit advocacy affiliate of the American Cancer Society. We advocate for evidence-based public policies to reduce the cancer burden for everyone. ACS CAN supports comprehensive insurance coverage and the elimination of cost sharing for recommended lung cancer screening and follow-up testing for asymptomatic individuals by all payers. Thank you.
Thank you, Ms. Atlas. It's good to see you, and we look forward to having you up in Carson City next week. All right, our next speaker.
Good morning, Madam Chair and members of the committee. Sasha Sutcliffe-Stevenson, SASHA, SUTCLIFFE, STEPHENSON, here for the Nevada Oncology Society. Want to thank the sponsor for bringing this very important bill and the committee for its consideration. Thank you.
All right. Thank you both so much. I don't see anyone else in Las Vegas, so we are going to move to the phones broadcast for testimony in support of Senate Bill 387.
If you would like to testify in support of SB 387, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of SB 387, please press star 9 now.
Hello, my name is Michael Ryan. I am a longtime resident of Nevada and Marine Corps veteran. I ditto the comments of previous testimony and support this bill. Please vote yes. Thank you.
And thank you for your service. Broadcast, do we have anyone else on the phones?
Chair, you have no one else wishing to testify in support at this time.
All right. Thank you so much. With that, we will open this up in opposition of Senate Bill 387 in our physical locations, and then we'll move to the phones. And not seeing anyone who wants to testify in opposition in person, we're going to move to the phones. Broadcast, back to you for anyone testifying in opposition of Senate Bill 387.
If you would like to testify in opposition of Senate Bill 387, please press star 9 now to take your place in the queue. Chair, you have no callers wishing to testify in opposition at this time.
All right, we're going to move to neutral then. Anyone who'd like to tell, oh, if Mr. Plain weren't here, it wouldn't be a day. Senate Bill 387, neutral.
Thank you, Madam Chair, members of the committee. Adam Plain, Plain, with the Nevada Division of Insurance. We are neutral on Senate Bill 387. Submitted written testimony. We do not evaluate the bill as triggering federal defrayal. I believe the conceptual amendment doesn't trigger federal defrayal as well. I did have a chance to communicate with Senator Lang electronically prior to the hearing. I did want to raise that in the individual and small group markets, theoretically, this coverage should be provided at no cost currently, because it is a U.S. Preventive Services Task Force B-rated recommendation. Did want to mention that there is some uncertainty around this. The U.S. Preventive Services Task Force ability to recommend items for preventive services under the Affordable Care Act was adjudicated by Judge Reed O'Connor out of Texas as being unconstitutional. It was appealed to the Fifth Circuit. The Fifth Circuit put a stay on that decision. It has been appealed to the Supreme Court. If the Supreme Court upholds Judge O'Connor's finding, then all recommendations from the U.S. Preventive Services Task Force will not be allowed to be incorporated as preventive services under the Affordable Care Act, which could potentially subject the state to defrayal if we now have a state mandate in the individual market for this coverage. There are some potential workarounds. Working with staff, we have some ideas. Be happy to work with Senator Lang to maybe implement some of those so as to not subject the state to further liability. Thank you.
Thank you so much. Not seeing anyone in Vegas who'd like to testify in neutral, we will go to the phone lines. Broadcast, is there anyone who'd like to testify in neutral over the phones on Senate Bill 387?
If you would like to testify neutral on SB 387, please press star 9 now. Chair, you have no callers wishing to testify neutral at this time.
All right, Senator Lang. Okay, we have no closing statements on Senate Bill 387, so we will officially close the hearing on Senate Bill 387, and we will open the hearing on Senate Bill 292, and welcome Senator Lang back to the table. Senate Bill 292 revises provisions relating to Medicare supplemental policies, and we welcome you and your co-presenters.
Good morning again. I'm still Roberta Lang, and I still represent Senate District 7 in Las Vegas. Thank you for having me here today. I am honored to present this bill. This legislation increases access to Medicare supplemental health insurance policies for Medicare beneficiaries under the age of 65. Most of you know Medicare is a federal health insurance program for seniors who are 65 years and older. A less known fact is that millions of individuals younger than 65 years of age can also enroll in Medicare because they suffer from end-stage renal disease called ESRD or certain qualifying disabilities. You may also know that seniors enrolled in Medicare choose to sign up for a Medicare supplement policy. It's also called Medigap insurance because it covers payments for coinsurance and copays, as well as certain deductibles and adds certain health benefits. However, federal law does not require insurance to offer such Medigap policies to Medicare beneficiaries under the age of 65. Leaving a substantial portion of the Medicare population vulnerable to high out-of-pocket costs. Research has consistently shown that younger Medicare beneficiaries face unique challenges. They are more likely to have low incomes, poor health, and severe chronic conditions. They also experience higher rates of access and affordability issues compared to older beneficiaries. A Kaiser Family Foundation study found that beneficiaries under age 65 with disabilities reported worse access to care, more cost concerns, and lower satisfactions with care than seniors. Currently, 36 states require Medigap insurers to issue at least one kind of Medigap policy to beneficiaries under the age of 65, typically through an initial open enrollment period. Unfortunately, Nevada is not part of these 36 states. The lack of access to Medigap policies can have severe financial consequences. For instance, this financial burden can potentially jeopardize Medicare's beneficiaries' chance to get a kidney transplant list, which, as you know, is very personal to me. For these reasons, the American Kidney Fund, an advocacy organization for people suffering from end-stage kidney disease, urges states to pass legislation that would require insurance companies to offer Medigap coverage to make it available to Medicare beneficiaries under the age of 65 and offers the same premiums, conditions, and services as those beneficiaries over the age of 65. Senate Bill 292 is aiming to fix this problem. Chair Pezzina, with your permission, I'd briefly like to summarize the bill's key provisions. Thank you. Section 2 establishes applicability of the definition of Medicare supplement policy in Section 3. Section 4 is the key section of the bill, and I will briefly summarize its subsections. Subsection 1 requires a health insurer offering Medicare supplemental policies to allow eligible individuals less than 65 years of age who are enrolled in Medicare due to disability or end-stage renal disease to purchase any Medicare supplemental policy that an insurer offers to insureds who are 65 years of age or older. And just to give you an example of this, so I'm getting a kidney transplant in the fall, and I'm over 65, so I have my Medicare, I have my supplemental policy, so therefore I will have no out-of-pocket expense. And so what I'm trying to capture is those people under 65 who are eligible for Medicare to be able to get a supplemental policy because the cost of a transplant is very large, and this way that they can be able to have their life and a chance to not be in debt from curing a health problem. Subsection 2 prohibits such insurers from imposing any limitation, term, or condition relating to coverage, benefits, protections, policies, and procedures with respect to Medicare supplemental policy issued to an individual under the age of 65 unless they are also applied to an insured who is 65 years of age or older. Subsection 3 requires insurers to offer a supplemental policy at the same premium rates as an eligible individual as they would charge individuals who is exactly 65 years of age for such policies. Subsection 4 sets forth an insurer must establish an open enrollment period to purchase Medicare supplemental policy during a 6-month period commencing the first day of the first month during which individuals less than 65 years of age are enrolled in Medicare Part B coverage, and subsection 5 prohibits an insurer from taking certain actions during an open enrollment period set forth in subsection 4, including but not limited to exposing an exclusion of benefits during the open enrollment period based on a pre-existing medical condition. Sections 5 and 6 make certain conforming changes, and sections 7 through 9 apply the provisions of section 4 to a hospital or a medical services corporation and a state and local governments that offer insurance to employees. Regarding the effective date in section 10, requires insurers to establish an open enrollment period for individuals who become eligible for Medicare supplemental policies when this bill passes. The period commences on October 1, 2025, and remains open through April 1, 2026. And now I'll turn it over to you.
Thank you, Senator Lang. Good morning, Chair Pazina, Vice Chair Daley, and members. Oh, thank you very much. Do you need me to repeat that for the record? Okay. My name is Pamela Zielske, Zielske, and I'm the Western Region Advocacy Director for Dialysis Patient Citizens. We're the largest nonprofit patient advocacy organization in the country that works on behalf of end-stage renal disease patients. I'm here today testifying in support of Senate Bill 292. Thank you, Senator Lang, for introducing such an important bill. As the Senator mentioned, Medigap plans cover the annual 20% of out-of-pocket costs that Medicare does not cover. For dialysis patients, these costs can be as high as $16,000 per year. The 36 states that Senator Lang mentioned require at least one Medigap plan to be available for eligible individuals who are under the age of 65. Of these states, 17 of them have passed affordable premium provisions like the ones included in SB 292. These ensure that plans are affordable to patients. By doing so, these states are leveling the playing field, they're keeping it even, and they're ensuring that patients are not penalized for getting sick earlier in life. Nevada's neighbors, Oregon and Idaho, are among the states that are already making affordable Medigap access a reality to the under 65 patient population. We are also seeing more states passing affordable Medigap laws each and every year. The state of Indiana, for example, just passed affordable Medigap to the under 65 population last year. It passed with almost unanimous support. The year before, Kentucky and Virginia passed affordable Medigap legislation. And this year, a number of states have introduced affordable Medigap legislation in addition to Nevada, including states of California, Texas, Georgia, and Ohio, just to name a few. SB 292 uses the proven same as 65 premium protection formula that has been in place in the state of Kansas since 1999. This is a well-tested model, and it works. Right now, a 65-year-old Nevadan has access to all 10 lettered Medigap plans. They're plans A through N. To give you an example, 27 different policies are offered for Plan A with a premium of between $110 and $259 per month. But if a person is diagnosed with ESRD when they're younger than 65, they can't purchase a Medigap policy in the state of Nevada because they simply aren't available. This explains why many dialysis patients spend down their assets into poverty so they can become eligible for Medicaid. It's important to point out that the pool of individuals who would be purchasing Medigap plans as a result of SB 292 would be extremely small. There are only about 1,500 ESRD patients in Nevada under the age of 65. Of this group, 991, or 62%, are considered non-duals. That means they're on Medicare, but they're not eligible for Medicaid. There are roughly 100,000 Nevadans who have Medigap plans. If SB 292 passed, absorbing some of these 991 ESRD patients who are not eligible for Medicaid would represent a de minimis amount of the overall pool, less than 1%. The report from Health Management Associates, or HMA, which is part of the record, explored this issue of cost. HMA, which is an independent actuarial firm, evaluated Medicare fee-for-service claims data and determined if Medigap carriers were required to offer policies to those under 65 with ESRD and set premiums at the same rate a 65-year-old is paying, which is what SB 292 requires. It would result in an increase to the overall pool of 0.9%, or about $2 a month. That's less than a cup of coffee. The bill can also help prevent cost shifting to the state's Medicaid program by preventing more patients from spending down their hard-earned assets to qualify for Medicaid, which picks up that 20% out-of-pocket cost. The HMA report estimated that as many as 1 in 4 non-dual Nevadans could annually avoid spending down their assets that leads to Medicaid eligibility, and estimated a savings to the state of roughly $900,000 over a 5-year period. The impact of SB 292 would be life-changing and life-saving for Nevadans with ESRD who are under the age of 65. It provides them and their families with much-needed financial security, and it offers a pathway to kidney transplant, as Senator Lang spoke about in her remarks. I urge your support for SB 292, and I'm happy to answer any questions. Thank you.
Thank you both so much. Do we have any questions from the committee? I was curious, how much would you say the cost is of a kidney transplant? And also, well, we'll start there. How much would you say the cost is of a kidney transplant?
Senator Lang, for the record, I think it's about $400,000, but can I phone a friend?
Absolutely.
Doctor?
Thank you. Thank you, Senator. My name is Ernesto Molmenti, M-O-L-M-E-N-T-I. I'm a transplant surgeon, and I'm here to advocate on behalf of all those who don't have a voice and who are suffering with end-stage kidney disease. Basically, in transplantation allows...
And we're going to give you a chance to present, but if you could just, how much would you say the transplantation cost is?
Similar to what the senator said, I also want to clarify one more thing. On a long-term basis, transplantation is cheaper than dialysis from a public health perspective. So we have to think on a rational basis that in addition to providing a better quality of life and a longer survival, transplantation is cheaper than dialysis when we look into several years.
Thank you so much. And my question was, as a follow-up, you mentioned those with disabilities and an end-stage renal failure who would be able to benefit from this Medigap plan. How many would you say there are in the state right now? I think you shared, but just to follow up.
So for end-stage, Pamela Zilski for the record. For end-stage renal disease patients who are under the age of 65, right now in Nevada, there are 1,547. However, some of those patients are eligible for Medicaid. And so the folks who are not eligible for Medicaid is 991.
Thank you so much. So not so many people, and the benefits obviously far outweigh the cost. That's what I was getting at. And thank you so much. Did we have any other questions from the committee? Senator Rogich.
Thank you again. With regard to the 400,000, that's just with regard to a kidney transplant. That doesn't include all the other items that a patient may need, such as beds and prescriptions, etc.
Senator Lang for the record. So if you're a kidney transplant patient, there are medications that you have to take. I mean, currently I take a lot of medication leading up to my transplant. After my transplant, I would take more medications that I would take the rest of my life, as it's a lifetime treatment plan, frankly.
Thank you so much. We are about to close the presentation and open it up, but if you have a quick couple minutes you'd like to share, Doctor, to close out the presentation.
Yeah, if you wouldn't mind, first of all, I'm delighted to be here with all of you and to share my support for the Senator's incredible idea. And I would like to mention that transplantation has two main benefits. One is to improve survival, and the other one is to improve the quality of life. And it's, as I mentioned, from a public health perspective, transplantation, after a few years, is cheaper than dialysis. So I'm a strong advocate of transplantation. That's why I came to Nevada to change what's going on now, because we need to be the #1 state in the whole U.S. And we're going to make it there with all your support as a team.
Thank you so much. And we're so happy that you're here in Nevada and that you're going to be part of that transplantation team. Is there anything else before we move to support?
Senator Pezzina, I have two people on Zoom, patients, that would like to just give a brief comments.
Of course. We'll have them join us now. Please begin when you're ready.
Good morning. My name is Charles Lizer, Lizer. I am from Winnemucca, Nevada, and I'm here to testify in support of SB 292. I am a 55-year-old dialysis patient. I have been doing dialysis since 2013. I dialyzed at a clinic in Winnemucca until 2022 when the clinic was shut down. I then switched to home dialysis and have done home dialysis for the past 2 years. I am currently on Medicare for insurance. I also work full-time, so I do not qualify for Medicaid. Nevada does not currently have Medigap for people on Medicare under 65, so I am responsible for the 20% of my medical bills. I do not have access to private health insurance. I am currently on the transplant list, and because I do not have Medigap, I cannot even consider the transplant until I have the 20% that the transplant center requires up front for the surgery. Which I am currently trying to save up for. I would really appreciate your support in this bill. It would mean a lot of dialysis patients like myself in Nevada. Thank you.
Mr. Lizer, thank you so much. And I also understand, having a family member going through dialysis, how challenging that is at home as well. So we really appreciate you sharing your story.
Good morning, honorable senators, all committee members. My name is Cindy Valetti. I am a lifelong Nevada resident from Henderson, and I'm coming before you today as a kidney patient in support of 292. I am here to tell you my short story about kidney disease and where my future looks for that. In 2018, I was diagnosed with high stage 3 kidney disease. With the help of a great nephrologist, a lot of hard work on my part, and a lot of support from the people at American Kidney Fund, I've managed to bring my numbers down, and I'm good at this point in time with continued work. But in having this, I have taken this diagnosis that I didn't understand to begin with and tried to turn it into something that I can help and teach and learn along with other people in our community who do have this disease. And one of the things that became apparent to me early on is in Nevada, there's something that they put out with the American Kidney Foundation is a yearly report card. And you've heard several people here already talk about where Nevada is in comparison to other states. And thank you to the doctor for coming here and being a part of trying to raise those numbers because they're bleak. And as you see, we have people in our state who suffer from this and have to worry about spending down their savings to qualify or to have to spend their time working hard to put that savings together to qualify for the transplant. I'm at an age where I'm looking at Medigap being something in my future. If one of my other diagnoses were to make the kidney disease numbers go up or for me to need that Medigap, and knowing that it's not available for people that work hard and didn't ask to be sick is frustrating and sad. So I'm hoping that everybody here knows how important this is to our community. And I believe that with kidney disease being one of the fastest growing conditions in our state, more people are diagnosed every year. And the significant gap in the coverage to pay for those crucial treatments is scary. So I'm hoping that with the pass of 292, it will allow people to concentrate on getting better and the numbers that they need to look at each and every month to make themselves better. By passing this, we would not only improve the lives of the patients, but we would send a message to everybody in Nevada that we stand with them, fighting for them to live, despite all the odds stacked against them. We're at a pivotal moment with the leadership we have and so much understanding of kidney disease in general, that with everybody's support, we could really make a difference in fighting kidney disease, helping our fellow neighbors, residents, and hoping that they don't have to choose between their health and financial security. So lastly, I just would urge everyone to look at the Nevada Kidney Report that comes out yearly, see where we're at with all of those things. We've changed some for the better. This could make it better than that. So I want to thank everybody for your time and hope that you will look into this further and definitely support SB 292. Thank you again for your time. And my name's Cindy Valetti, V like Victor, A-L-L-E-T-T-E.
Thank you so much, Ms. Valetti, for joining us today and sharing your story. I think we did have one more question from Senator Rogich.
Thank you, Chair. I just want to clarify further that if an individual is under 65, that the patient has to pay the 20% out of pocket for a transplant because the person doesn't have the Medigap. With the Medigap, as second insurance, they can stay on the list, which is life-saving.
Pamela Zilski, for the record. Yes, Senator, that's correct.
Yes, one more comment, and then we'll go ahead and move into our support.
Thank you. Two comments. First of all, for you to be aware, the mortality on dialysis is 10% a year, approximately. So after about 5 years, 60% of all people on dialysis are dead. That's from coming for you to be aware what we're dealing with, the underlying issue. The other issue, Senator Pazina and Chuck, if you hear me, you mentioned you have a relative and check you need a transplant, come and see me so we can transplant you, all right?
Thank you so much. And we really appreciate the presentation this morning on Senate Bill 292, which is such an important bill. And with that, we are going to open up for testimony in support of Senate Bill 292.
Good morning, Madam Chair and members of the committee. My name is Josie Gomez. I am the Associate Director of State Policy and Advocacy with the American Kidney Fund. I am here today to testify in support of Senate Bill 292, which seeks to expand access to Medigap insurance for kidney patients, providing them a better opportunity for a healthier life and longer lives. Medigap coverage is especially critical for kidney patients in Nevada because Medicare only covers 8% of their medical expenses, leaving many patients with significant out-of-pocket costs for life-sustaining care. Additionally, having a secondary insurance coverage, such as Medigap, is a key requirement in the transplant evaluation process. Due to the scarcity of available organs, transplant centers require patients to demonstrate they have adequate insurance to cover the ongoing medical costs necessary to maintain a transplant organ. Without Medigap, many kidney patients face a major barrier to receiving life-saving transplant simply because they lack sufficient coverage. By expanding access to Medigap, Senate Bill 292 would help ensure that kidney patients can afford the care they need, improve their chances of receiving a transplant, and ultimately enhance their overall health and quality of life. Thank you for the opportunity to testify and for your time and consideration on this critical issue. I appreciate the committee's commitment to improving healthcare access for kidney patients, and I welcome any questions you may have.
Good morning, Madam Chair and members of the committee. My name is Diana Arevalo, and I have the privilege of serving as the Managing Director of Advocacy at the ALS Association. Today, I stand before you on behalf of the nearly 300 brave individuals in Nevada who are facing the unimaginable reality of living with ALS. I come to you with a simple, urgent request. Please support Senate Bill 292. ALS, amyotrophic lateral sclerosis, is a devastating disease. It takes away a person's ability to walk, talk, eat, and breathe, and yet there is no cure. For those living with ALS, every single day is a battle, not just against the disease itself, but against the overwhelming financial and logistical burdens that come with it. The cost of care can exceed $250,000 per year, forcing families to make heartbreaking decisions, draining retirement savings, taking on debt, and worrying about how to protect their children's futures. One of the most pressing concerns for these families is health insurance. This bill offers a vital solution by ensuring that people under the age of 65 who are living with ALS can access affordable Medigap coverage. This would help close a dangerous gap in healthcare, giving patients and their loved ones peace of mind during an unbearable time. Most people with ALS qualify for Medicare as soon as their Social Security disability benefits begin. But Medicare alone isn't enough. It covers only 80% of the medical expenses, with no cap on out-of-pocket costs, prescription costs, and durable medical equipment. For many, this means thousands of dollars of expenses just to access essential care. Medigap coverage would be the difference between affording life-sustaining care or going without. Expanding Medigap coverage is more than just a policy change. It's a lifeline. For those reasons, I urge you to support Senate Bill 292. Thank you.
Are there any questions I can answer for any of my new friends here?
I think we are good, but we want to make sure we open up seats so that more people can testify in support because this is such a wonderful bill. We just don't want to leave anyone out.
Thank you.
And again, thank you so much, Doctor, and thank you for coming to Nevada to practice.
Good morning, everyone. I am Amy Hewitt. I am the Executive Director for the National Kidney Foundation, serving California, Nevada, Oregon, Washington. Thank you, committee, for allowing me to speak today. I'm also a living donor, and I would like to thank Senator Lang for introducing this bill. The National Kidney Foundation supports Nevada's SB 292 because it ensures all patients with end-stage renal disease, regardless of age, have access to critical Medigap coverage. Without this supplemental insurance, younger ESRD patients, like the patient I donated on behalf of, face devastating out-of-pocket expenses. This bill is a vital step towards health equity and financial protection for some of the state's most medically vulnerable residents. SB 292 represents a common-sense, fiscally responsible solution that promotes equity, improves treatment adherence, and reduces the burden of uncompensated care on Nevada's healthcare system. Thank you for allowing me to share.
And thank you so much for being a living organ donor. One of my proudest moments was when the legislature passed the Living Organ Donor Protection Act a couple years ago. Thank you.
We are very appreciative that you did that.
Good morning, Chair and members of the committee. I'm still Jacqueline Wynn, NGUYEN, representing the Nevada State Medical Association. We'd like to thank Senator Lang for bringing forth this important bill. This bill is actually very important to me because I've seen firsthand the medical difficulties and financial hardship patients face. I helped my niece Brittany, who has a disability, through the long process of receiving her own kidney transplant just 2 years ago. Brittany's now thriving, but the cost of her care was a constant worry for my sister. Medicare supplemental insurance, or Medigap, is sometimes a crucial resource for patients that can provide significant financial protections and access to care. Therefore, all our physician members are in support of SB 292. Thank you.
Thank you, and we hope Brittany has a chance to come visit us here in the legislative building.
Good morning, Chair and members of the committee. For the record, Jessica Ferrato, Ferrato, here today on behalf of Fresenius Medical Care, a large kidney health organization that provides care across the state, including outpatient dialysis clinics. We're here in support of the bill. We'd like to refer you to our letter of support in the exhibits, and for sake of brevity, want to just communicate our support and gratitude for all the patients that are here today. Kidney failure is a very challenging illness and disease and takes a lot out of the patient. So the fact that they were able to commit their time today shows how much support there is for the bill. Thank you for your time.
Thank you so much. All right. We are going to head to the phones. Broadcast. Do we have anyone who'd like to testify in support of Senate Bill 292 on the phones?
If you would like to testify in support of SB 292, please press star 9 now to take your place in the queue.
Good morning, Chair Pazina and committee members. My name is Jim DeGraffenreid, JIMDEGRAFFENREID, testifying on my own behalf today as a licensed health insurance agent in the state of Nevada. This is a very important bill to fill a gap that exists for those under 65 who are forced onto Medicare after 24 months of disability, but then once they're on Medicare are unable to buy the Medigap plan to fill in the costs that Medicare does not cover. At the same time, because they are on Medicare, they're ineligible to go to, for instance, the health insurance exchange. We have had a number of our clients fall into this gap, and we really appreciate this bill being brought forward to help these patients. Thank you.
Thank you, Chair and members of the committee. For the record, this is Elliot Mallon. I am representing the Nevada Osteopathic Medical Association, but I am also speaking a little bit on my own behalf today. First, I want to thank Senator Lang for bringing this. For those of you that I've known for a long time, you know that I am a living organ donor, and this kind of legislation would have helped my cousin had we not rushed into this surgery. And I think of so many people like my cousin and like a lot of my new friends who have become organ donors or are on the transplant list and how this would help them. I can't express how grateful I am to see this kind of legislation coming forth again to protect Nevadans and to help those on the transplant list. Senator Pazina, I also want to thank you for bringing up the Living Donor Protection Act and all of your hard work to advance organ donation in the state of Nevada. So thank you all, and I urge your support of this bill.
Chair, you have no more callers wishing to testify in support at this time.
Thank you so much, and thank you to everyone who's testified in support in person and over the phone. We will now move to testimony in opposition of Senate Bill 292.
Good morning, Madam Chair, Vice Chair, members of the committee. For the record, I am Trey Abney, Trayabney, here today representing America's Health Insurance Plans, otherwise known as AHIP. We respectfully oppose SB 292. As you've heard, Medigap coverage was created specifically to provide seniors over 65 years of age with a bridge to cover costs that are not covered by traditional Medicare. As such, those rates are based on actuarial models that consider that specific population. And this is specifically done to ensure that low and fixed income seniors are not subject to rate shock or increased rates due to expanding that pool of recipients. In fact, Medicare Advantage already exists, and those plans are open to seniors under 65 and cover a variety of things. In fact, federal law requires that Medicare Advantage plans cover end-stage renal disease or ESRD. We know that ESRD population has extremely high healthcare costs. On average, ESRD beneficiaries incur spending that is about 6 times greater than spending for beneficiaries age 65 years and older without ESRD. Requiring carriers to include under 65 patients in the Medigap risk pool and restricting premium rates for these individuals to the lowest possible rate will increase premiums for the seniors for whom these policies were created in the first place. Many Medigap enrollees are lower income and live in rural areas. Shifting the expense of the under 65 population onto seniors with Medigap policies would add a significant burden to this vulnerable group. Medigap insurers do not receive any additional state or federal funds to offset the increased costs of covering an under 65 enrollee. The costs of the risk pool are paid solely by the patients in the form of premiums. If a risk pool's costs increase substantially, premiums for future years will increase to cover the additional spending. So we respectfully oppose, but Senator Lang is always great to work with, and we will continue those conversations. Thank you, Madam Chair.
Thank you so much. Seeing no one else in our physical locations broadcast, we're going to head over to you to the phones for testimony in opposition of Senate Bill 292.
If you would like to testify in opposition of SB 292, please press star 9 now to take your place in the queue. Chair, you have no callers wishing to testify in opposition at this time.
Wonderful. That is going to move us to neutral. Anyone who'd like to testify in neutral on Senate Bill 292? Oh, wow. Mr. Plain's not coming to the table. All right. Broadcast, anyone on the phones?
If you would like to testify neutral on SB 292, please press star 9 now to take your place in the queue. Chair, you have no callers wishing to testify neutral at this time.
Thank you so much. Would you like to make any closing statements on Senate Bill 292?
Thank you, Chair Pazina. Senator Lang, for the record. I know our time is short, but I just wanted to really thank you a lot for hearing this, because oftentimes we forget about the people who are affected by these kinds of diseases. And it's, like me, I had no kidney disease in my family. I'm the only person. And mine is very rare. 1 in a million people get what I have. But we don't, had I been under 65, I would have been in the same situation. And I can't hardly imagine what it's like. For instance, the 2 people that testified, it almost brought me to tears because of what they have to go through. It's a hard enough disease on its own. And I think it is, I encourage you to support 292 so that we can help people like the 2 people that testified today. Thank you so much.
Thank you so much. That will close the hearing on Senate Bill 292. And Senator Lang's very busy start to the morning with a work session and 2 bill presentations. And we will open the hearing on Senate Bill 327 and welcome Senator Cruz Crawford.
Good morning, Chair Pazina and committee members. I am Shelley Cruz Crawford, representing Senate District 1 in Clark County. And today I am pleased to present Senate Bill 327, which revises certain bond requirements for contractors. I do have a special guest right behind me. You can see her knees and her Doc Martens. My daughter, Lola Crawford, who's studying to be a teacher at UNR, is in attendance to see this, her first ever hearing. But my co-presenters are Adam Brickmeyer, the Vice President of Government Affairs at the Surety and Fidelity Association of America, and I also have Mark Suckman, the Vice President of Government Relations at the American Property Casualty Insurance Association, and Leah Cartwright, who's the President of Cartwright Nevada Government Affairs. And with that, I will hand it over.
Good morning. My name is Adam Brockmeyer, ADAMBRACKEMYRE, and I'm Vice President of Government Relations for the Surety and Fidelity Association of America. Why do we have this legislation in front of us? Last year, there were about 36 contractors that we know of that were going to lose their license in the state because the surety bond that they're required by law to possess, the surety bond company was going to be downgraded from an excellent financial condition to very good. This action would have resulted in the loss of licensure and the stoppage of a number of construction jobs across the state because state law requires the surety bond company rating to be excellent. Thankfully, the contractor board and contractors were able to work together and keep their license in good standing, and no jobs were stopped. But this is a situation that I think most would look at and say, we shouldn't be having this potential stoppage happen at all. So at the Surety and Fidelity Association, we looked at exploring other options to changes in Nevada statute to prevent these unnecessary stoppages for contractors due to the sole reason that the surety bond company drops from an excellent rating to a very good rating. So we have approached the contractor board in the past 9 months and been working with contractor groups on some ideas to change Nevada statute. So the language we have in front of you is language that is law in several states requiring contractors' bonds to be T-listed or listed on the Treasury circular. In layman's terms, this means that the company is eligible to do business with the federal government, which is something that a lot of surety companies do. This T-listing requirement would eliminate the uncertainty and potential disruption that we saw last year. And the language in the bill comes from a neighboring state, Utah. And that's the idea behind the bill. And I'll be happy to answer any questions. Thank you very much.
Good morning, Chair and members. My name is Mark Suckman. That's S as in Sam, E, K, T as in Tom, N as in Nancy, A, N as in Nancy. And I represent the American Property Casualty Insurance Association. APCI is a national trade association of insurance companies and represents more than 65% of the insurance market. SB 327 changes the standard to determine the financial qualifications of a surety company writing bonds in Nevada. Current Nevada law relies on the rating of a private rating agency. SB 327 instead provides that the financial qualifications of a surety will be based on a more comprehensive tool provided by the U.S. Department of Treasury. As Adam mentioned, we have been working with the Contractors Board on this issue. APCI requests your support on SB 327. Thank you.
Okay, do you have any more presenters or do you stand ready for questions?
Shelley Cruz Crawford for the record. We are ready for questions.
Thank you so much. That was a quick presentation. All right, do we have any questions from the committee? Senator Ellison and then Senator Flores.
Mine's real simple. This is a great bill, and I'm glad to see it here. This should have been here a long time ago. Thank you.
All right. Actually, we're going to move to Senator Daley instead.
Thank you, Madam Chair. And for the one gentleman, the first one that spoke on Zoom, where he talked about a job was stopped or somebody had lost their surety bond because their company went below. A little more explanation on that, what exactly happened, and then what prevents the same thing happening from a little bit lower level if they have one of the guys on the list. And so we would just shifting it to a little lower level, and I hope the contractors board is good with this. We'll see in a minute, but I'm not an expert on surety bonds, so I'm just trying to get the explanation of what was the catalyst, and are we actually going to solve it, maybe make it a little easier so there's less chance of it. That's what I want to find out.
Adam Brockmeyer, Senator, in response to your question, there was a ratings downgrade for the parent company of the surety, and that was the reason behind it. So what I'd like to say is that we are changing the status of surety companies. Instead of grading A, B, C, D, F, we're changing it to pass-fail with the Treasury list. This should promote greater stability for the availability of bonds and lessen the predictability or the downgrades that I mentioned. And I hope this responds to your question.
Follow up, so make Edgar happy. Anyway, yes, I think it does. So there wasn't any specific project or contractor that you're referencing, and I understand the list. I was looking it up while we were doing that. The circular 570, several hundred contractors or surety companies on there, and I get the stabilization part instead of the A, B, and C. I was just looking to see if there was a project that you had mentioned that or something had stopped because of this.
Senator, in response to your question, there was not a specific project that stopped. There was the potential for that to occur had not the contracting board and contractors found new bonds or reached accommodations to stay properly licensed under Nevada law.
And out of curiosity, with that question, moving from grades to pass-fail, what are the requirements for a pass-fail? Is it what would have been a C grade is now a pass? And again, I'm just curious because I'm also not an expert on surety bonds.
Adam Brockmeyer, Madam Chair, in response to your question, the U.S. Treasury has a financial rating system, and they evaluate the financials of sureties and allow them to write a specific amount of money or specific amount of business for the federal government. As you can imagine, the federal government is a very large procurement agency, and companies have an incentive to become T-listed and to act in good faith. And we feel that the T-listing provides a good character screening because no company wants to lose the ability to do business with the federal government.
All right. Any further questions? Okay. Not seeing any. We thank you so much for the presentation today, and we'll have you both step back from the table so that we can get testimony in support of Senate Bill 327.
Chair Pazina? Shelley Cruz Crawford for the record. Right before we started, I did get some information from the Contractors Board, so they are going to be in opposition today, but I'm very hopeful that we'll work out an amendment so that it does meet all the needs. So thank you.
Thank you so much. Right. All right, with that, we will open up for testimony and support on Senate Bill 327. I know this was just scheduled very recently, so apologies as things get added to the agenda as deadlines approach. Not seeing anyone in our physical locations, we are going to move to the phones. Broadcast, is there anyone on the line in support of Senate Bill 327?
If you would like to testify in support of SB 327, please press star 9 now to take your place in the queue. Chair, you have no callers wishing to testify at this time.
Thank you so much, Broadcast. All right, we are going to move to testimony in opposition of Senate Bill 327. We'll start in our physical locations, and then we will move. Was there someone at the table who wanted to testify in support, actually, of Senate Bill 327 in Las Vegas? I am so sorry. I didn't see you, and that is my fault. So we're going to open that back up so you can testify.
No worries, Chair. That was my mistake. I'm sorry. It moves quickly than I came up here. So good morning, Chair and members of the committee. For the record, Ann Barnett, CEO for the Nevada Contractors Association, in support of SB 327, revising bond requirements for licensed contractors by aligning them with standards recognized by the U.S. Department of Treasury, enhances consistency and reliability in bond issuers without placing an undue burden on contractors. We ask for your support for SB 327. Thank you.
Thank you so much. All right, with that, we will switch it up and move into opposition of Senate Bill 327, and we'll start in our physical locations.
Good morning. Susan Broyley-Camish for the record. Good morning, Chair Pazina, Vice Chair Daly, and members of the committee. I am speaking on behalf of the Nevada State Contractors Board today. We are in opposition of SB 327 in its current form. As you know, the Nevada State Contractors Board is tasked with protecting the health, safety, and welfare of the public. One way we do that is by requiring licensed contractors to provide either a surety or a cash bond in order to maintain an active license in Nevada. If I can say, what caused this kerfuffle last year was we sent letters to bonding companies who had moved to an A- rating. We have since revised our process and we do accept A- rating bonds. So anything below an A-, we will ask them to get a new bond. So it sounds like no projects were impacted, but we did our job of protecting the public by doing this. The Nevada State Contractors Board current statutory mandated requirement of accepting a bond from a bonding company with an A- rating or better has been successful in protecting the public. The proposed change to alter the bonding requirements offers no additional protection to the public. As stated previously, the Nevada State Contractors Board is opposed to SB 327 in its current form. However, we are happy to work with the bill sponsor regarding any additional amendments to this bill. Thank you.
We do, it looks like, have a question for you from Senator Ellison.
Thank you, and I appreciate you coming forward. But the problem I've got is I'm getting a lot of calls into my office in Elko, and these bonding companies, or a lot of them, or most of the people that send their information is out of state, and when they do, they'll ask for the information, they'll send it to them, they'll say we don't get it, they'll send it to them again, they said they don't get it, and they're bringing these files of papers in. In the meantime, then they're being contacted that they could be revoked because of it. So we're trying to make calls and say, hey, wait a minute, these guys are sending this stuff in. So that's my problem with some of these bonding companies, and it's getting worse by the day by these people that mostly the companies they have a branch here, but most of their paperwork come from out of state, and that's the problem we're running into. So thank you, if you can answer that.
Thank you. We don't, for clarification, we would suspend a license if we don't get a bond, if they don't have a bond in place, and this is for protection of the public. We don't have jurisdiction over insurance companies or surety companies, but maybe our friend from the insurance division of insurance is here. We do give a contractor 30 days to replace their bond. So even if their bond has canceled, we still provide them 30 days to replace that bond. So we're not rushing out and just suspending that license. We do provide them adequate time to replace that bond. Does that answer your question? Oh, Susan Broyley-Camish for the record.
Yes, it does. The problem that comes with the fear of them losing their license and the contractor board. Thank you guys so much for giving them that extension, but it's a fear that they will lose that. Right. And then by the time they're trying to find another one, that's the problem.
Thank you.
So, but I'll get you a list of some of these people that did have that problem. You might be able to talk to them.
Yes, please.
Thank you.
Happy to look into it.
And before you leave, I believe Senator Daly also had a question.
Thank you, Madam Chair, and just following up on that, and I know, and I hope you can come to some arrangement with the sponsor of the bill, and I'm all for making sure we have qualified contractors that are going to be able to meet the financial responsibilities in case there's a default and various things. And I know in other dealings I've had with contractors, we've gone after their bond over trust fund issues and various things. So we want to make sure we have quality bonds as well. But if we went to this different system, open that up, obviously there's going to be more competition. Do you think there'll be It'll be easier on contractors, still have quality bonds, maybe at a better premium, maybe remove some of the barriers of smaller companies getting in. And I know that's the subject of another bill that's coming through this session. So do you think on that side of it, irrespective of the other part, there would be a positive effect on having more opportunities, hopefully better premiums, less restrictions on access?
Thank you, Senator Daly, for the question. Susan Broyley-Camish for the record. I have been with the Contractors Board for almost 15 years. During that time, I am unaware that anybody's had trouble getting a bond. Bonding companies do look at their financial condition, though, of these licensees. So if for some reason they don't have the financial wherewithal to run a contracting company, the bonding company's going to know that, and they might not issue them a bond. But like I said, in the 15 years that I've been there, I haven't heard anybody have a problem getting a bond.
Okay, thank you so much. We are going to move to Las Vegas. I don't believe the microphone is on.
Sorry about that. Hi, my name is Lisa Stevens, Lisa-Stevens, and I am a Nevada licensed surety broker. I've been licensed since 1996. I'm also a board member of the Nevada Surety and Fidelity Association. I am testifying today because we were not consulted by the national level of the Surety and Fidelity Association. We were unaware of this request to change the regulations to support treasury listing in lieu of an AM Best rating. When we were made aware of that, I did some research and found the letter that was sent to the Contractors Board from the SFA. So we reached out to Adam Brackemeyer and had a conversation with him on February 13th. In reviewing the letter sent to the Contractors Board, it states that because of the A rating requirements, contractors may not be able to obtain bonds and could lose their licenses or not be able to obtain licenses. In my experience as working as a licensed surety broker since 1996, this has not been the case for me and some of my colleagues that are also on the Surety Association board. There are many sureties. I can name 15 sureties that I regularly write with, I'm appointed with, and there are many, many more that I may not do business with that are qualified A-rated companies that provide Nevada contractors license bonds based upon their underwriting criteria for approval. What I would say is that the Surety and Fidelity Association represents sureties on this issue. In the beginning of the letter, it specifically states that they are representing surety companies. The board members of the Nevada and Fidelity Association, while we respectfully appreciate what the Surety Fidelity Association does
We are
on a
at 2
national
minutes,
level,
so if you can wrap up and then make sure that you share any comments with the
Sure.
committee secretary via email. Thank you.
Okay, so we respectfully disagree that T-listing is a necessity. AM Best ratings are updated regularly. They are real-time updates about financial status, whereas treasury listings are only updated on an annual basis.
Okay, thank you so much.
AM
It
Best
was a
ratings give
finish
the
it
red
up, and
flag.
but we thank you very much.
Okay.
Please do provide via email,
Thank
which is
you.
on the agenda, all of your comments so we can make sure that everything is added to the record, and we thank you so much for your time. Is there anyone else in Las
Perfect. Thank you.
Vegas?
Sorry about that.
No worries. Thank you so much. Is there anyone else in Las Vegas who'd like to testify in opposition of Senate Bill 327? Okay, we are going to move to the phones. Broadcast, do we have anyone on the phones in opposition of Senate Bill 327?
If you would like to testify in opposition of SB 327, please press star 9 now to take your place in the queue. Chair, you have no callers wishing to testify in opposition at this time.
Thank you so much. Do we have anyone who'd like to testify in neutral on Senate Bill 327? Seeing no one in our physical locations, broadcast back to you. Anyone on the phone lines to testify in neutral of Senate Bill 327?
If you would like to testify neutral on SB 327, please press star 9 now to take your place in the queue. Chair, you have no callers wishing to testify neutral at this time.
Okay, thank you so much. Would the bill's sponsor like to come back and make any closing statements on Senate Bill 327?
Shelley Cruz Crawford to the record. Leah Cartwright will be sharing closing comments.
Thank you, Senator, and thank you, Madam Chair, for the permission to close out this bill hearing. Leah Cartwright, LEACARTWRIGHT. I represent APCIA. That was Mark Secknan, who is there, and our member company, SFAA. I just wanted to clarify that the Nevada revised statute in 624.270 currently requires an A rating or better. The kerfuffle that happened last year was caused by those bond ratings downgrading from an A to an A minus, which required the Board of Contractors, the bonding companies, and the contractors themselves to work together to come up with this policy to allow A minus bonds, which may not technically be allowed in statute, but are through policy now. So this T listing does help clarify what's allowed. It's also consistent across the nation. Nevada is the only state that we've been able to find that has a surety bond rating requirement in statute, which does, as some of you, the senators, have pointed out this morning, could cause some barriers to entry, especially for those smaller folks trying to get into this line of work. Thank you.
Okay. Thank you so much. And with that, we will close the hearing on Senate Bill 327, and we hope that the sponsor has an opportunity to speak with the Contractors Board. And again, I know this was scheduled at the last minute, and I always remind everyone, make sure you're connecting with the bill sponsor. As I can tell you this session, I have a number of people who've never connected with me that I've heard are in opposition of some of my bills. So there you have it. We look forward to further discussions, and we thank you. We are going to take a quick 2-minute recess before moving forward with Senate Bill 171, just because we've been in here a while, and I want to give everyone a quick 2-minute break, but be back here promptly at about 9:42. All right, we are back in session. Thank you so much. Just after 3 work sessions and 3 bill hearings, it felt like a good idea to take a little break before we move into our final bill hearing of the day. I would like to welcome Senator Orenshaw and his co-presenters on Senate Bill 171, enacting a shield law to protect the transgender community. And with that, we welcome you, and you can proceed when you're ready.
Good morning, Chair Pazina, members of the Senate Committee on Commerce and Labor. For the record, my name is James Orenshaw. I represent State Senate District 21 down in Southern Nevada. Thank you for the opportunity to present Senate Bill 171. Co-presenting with me here in Carson City is Andre Wade, State Director for Silver State Equality. Down in Las Vegas, I've got Rob Phoenix, who's an advanced practice registered nurse and healthcare provider in Southern Nevada, practicing in the area of gender-affirming care. Also, I have psychologist Dr. Lauren Chappell-Love in Las Vegas. On Zoom, I have Gabby Doyle from the Trevor Project, which is a national suicide prevention organization that focuses on services to the LGBTQ+ community. Chair Pazina, with your permission, I'll provide some brief introductory remarks. Then I'd like to turn it over to the co-presenters. Then I'm happy to stand for any questions on Senate Bill 171. Thank you. Some of the committee may remember the policies in Senate Bill 171 from last session. Senate Bill 171 is a reintroduction of a similar measure I sponsored last session, Senate Bill 302, which passed both houses of the Nevada Legislature, but was vetoed by the governor. I've spent countless hours with stakeholders going over the governor's veto message regarding Senate Bill 302 of the 2023 session, and I believe that Senate Bill 171 addresses the concerns that the governor expressed in his veto message in June of 2023. I would like to explain why Senate Bill 171 is so vital and necessary here in Nevada. Many states have criminalized or otherwise restricted gender-affirming care, even medically necessary and provided with the informed consent of patients and their families. Between 2018 and 2022 alone, 48 anti-gender affirming care laws which restrict the rights to seek this care were passed in 19 different states. According to CNN, 26 states have passed bans on gender-affirming health care for transgender children and teenagers. These bans have a pervasive effect and have already caused significant harm to the community. For example, a recent study estimated the impact of state-level anti-transgender laws on suicide risk for young transgender and non-binary people between 13 and 24 years of age. The study found a statistically significant increase in the rate of suicide attempts for this community in the years immediately following the enactment of state anti-transgender laws relative to states that did not pass such legislation. The study's authors concluded that these findings highlight the need to consider the mental health impact of recent anti-transgender laws and to advance protective policies. These states' actions, in my opinion, not only harm transgender individuals, but also create a climate of fear and uncertainty for healthcare providers who offer gender-affirming healthcare services. For example, certain anti-transgender laws impose severe punishments on the healthcare practitioners providing such services, in some states up to 10 years in prison and a fine of up to $15,000. Keep in mind that gender-affirming healthcare services are medically necessary treatments for individuals who experience gender dysphoria. According to the most recent Diagnostic and Statistical Manual of the American Psychiatric Association, this condition results from a mismatch between an individual's gender identity and the sex assigned to them at birth. To be diagnosed with gender dysphoria, an individual must meet certain diagnostic criteria that are associated with clinically significant distress or impairment in social, school, or other important areas of functioning. Gender-affirming healthcare services may include hormone therapy, surgery, or psychotherapy, to name a few. I want to note that such services do not include conversion therapy, which is considered unethical and leads to adverse mental health outcomes and is prohibited in Nevada. Senate Bill 171 addresses this growing concern about the politicization of healthcare and the potential for discrimination against transgender and gender nonconforming individuals. The bill's objective is to establish a shield law that protects gender-affirming care and is in response to legislative actions in other states and the current hostility towards gender-affirming care on the federal level. I will now summarize the sections of the bill. Section 1 prohibits healthcare licensing boards from disqualifying or punishing a licensee solely because the licensee provided or assisted in providing medically necessary gender-affirming healthcare services or was subject to judgment, discipline, or other sanction from another state for providing or assisting in providing such services. This protection of healthcare providers applies only if the services were provided with parental consent, except if Nevada law would expressly authorize a minor to consent to such services. Subsection 2 of Section 1 sets forth detailed definitions for gender-affirming healthcare services, healthcare licensing board, and what is medically necessary. Section 2 prohibits the governor from surrendering or issuing a warrant for the arrest of an individual who is charged in another state with a crime that involves providing, assisting, or receiving medically necessary gender-affirming healthcare services, unless such acts are also considered criminal under Nevada law. In addition, Section 2 excludes from this prohibition circumstances where executive authority of another state demands the surrender of a person who is physically present in the demanding state at the time of the commission of the alleged offense and then fled from that state. Section 3 prohibits state agencies and the executive department from providing information or using certain resources to assist in an investigation or proceeding initiated in another state related to providing, assisting, or receiving such services, except under certain limited circumstances. Finally, Section 4 requires healthcare licensing boards to examine the feasibility of providing licensure reciprocity for out-of-state providers of gender-affirming healthcare services to ensure that people seeking these services have access to quality care. In the governor's veto message on Senate Bill 302 in June of 2023, the governor noted that he felt that Senate Bill 302 inhibited the executive branch's ability to be certain that all gender-affirming care related to minors comports with state law, and that it also decreases the executive branch's authority to ensure the highest public health and child safety standards for Nevadans. In drafting Senate Bill 171 before you today, I have tried to address the governor's concerns from his June 2023 veto message. Senate Bill 171 assures that only medically necessary care that comports with state law will be provided to patients across the state, and that state healthcare licensing boards will not be precluded from disciplining healthcare practitioners for any inappropriate care. With your permission, Chair Pezzina, I'd like to now turn it over to my co-presenters, and then I'm happy to stand for any questions.
Good morning, Chair. Good morning, Chair Pezzina, Vice Chair Daley, and members of the committee. My name is Andre Wade, and I am the State Director for Silver State Equality, a statewide LGBTQ+ civil rights organization in Nevada, and my name is spelled ANDREWADE. First, I want to start off by thanking Senator Orenshaw for sponsoring this bill again this session so that we can ensure that we protect healthcare providers of gender-affirming care in Nevada and those seeking care from another state. Gender-affirming care shield law is needed because it protects individuals and healthcare providers from legal consequences in states where gender-affirming care is legal, like Nevada, from actions taken by states where care is banned. Across the nation, 27 states ban gender-affirming care, causing individuals and families to seek care in states where it is available. SB 171 aims to protect providers and those seeking care, similar to the SHIELD law for reproductive care that was signed into law last session. There are reports that dozens of parents are calling LGBTQ+ centers in Nevada from neighboring states like Utah and Idaho to find out how they can access care for their child. These are parents who are advocating on behalf of their child. These are parents who want what's best for their child despite the obstacles ahead of them. Regarding providers, we have a documented shortage in Nevada, which also includes mental health providers. We need them to know that they have protections when delivering care legally available to patients. We need healthcare providers to stay licensed here and not choose to leave because they don't have necessary legal protections from other states that want to overreach into Nevada and to impose their laws. For example, in November 2023, the Texas Attorney General attempted to seize records of transgender patients from a Seattle Children's Hospital months after a Texas law banned puberty blockers and hormone therapy for transgender youth. The move was characterized as Texas testing how far it could extend its gender-affirming care restrictions beyond its state lines. Eventually, the case was settled, and the hospital in Seattle did not have to provide Texas with any information. And there was a similar attempt by the Texas Attorney General and a healthcare provider in the state of Georgia. Additionally, there's a bill pending in Texas that proposes in-state liability for someone in Texas who refers a child to a healthcare provider in another state, creating the threat of subpoenas seeking medical information in Nevada with which to prosecute therapists, pediatricians, pediatric endocrinologists, and others in Texas. This month, a bill in Arkansas was introduced that would allow lawsuits to be brought against people outside of Arkansas if they are deemed to have helped a transgender child transition. The way the bill defines transition not only means for medical care, but also for social transitioning like clothing, pronouns, hairstyles, and names, which is a core function of gender-affirming care. The penalties that the bill proposes is $10,000 per defendant, with punitive damages reaching up to $10 million for those involved in medical care. These bans on gender-affirming care started off by targeting youth. However, there are some states like Ohio that are attempting to restrict care for adults. There are states like Florida that are attempting to greatly restrict access to care for adults, causing some to seek care in other states. These are some real examples of real threats out there to providers and families seeking care in Nevada that is legally available to them, and broadly speaking, covered by certain insurance companies depending on individual plans. We simply don't want other states imposing their laws on us here in our great state of Nevada. And SB 171 by no means would decrease the state of Nevada to provide oversight of medically necessary gender-affirming care. If anything, it emphasizes that care cannot be provided simply because someone wants it without any basis of need. If we can, that concludes my remarks. If we can switch up the presentation to have Dr. Lauren Chappell-Love go first. She's virtual. She's a little pressed for time.
Good morning. Thank you very much for your consideration here. I'm hopeful that everyone can hear me, so I'll start right in without further ado. Good morning, Chair Zena, Vice Chair Daly, and all the other members of the committee. We truly appreciate your time this morning in considering SB 171. To start, my name is Dr. Lauren Chappell-Love, last name CHAPPLE-LOVE, and I'm a licensed psychologist here in Nevada. As it has been my habit, this legislative session, I plan on keeping it as simple as possible. I'm here today in strong support of SB 171. It's a bill that, as was aforementioned, is going to simply ensure that healthcare providers, master's level, doctoral level, etc., can continue to offer essential and evidence-based gender-affirming care without fear of discrimination or legal retaliation for simply doing our jobs. So as a psychologist, I'll speak to my scope of practice. I see firsthand the impact that inclusive, affirming care has on mental health. We see research from the American Psychological Association, commonly known as APA, consistently showing that when individuals have access to gender-affirming healthcare, they experience lower rates of depression, anxiety, suicidal ideation, and in general tend to have more positive health outcomes. Denying or restricting this care does the exact opposite. It literally will put people's lives at risk. Gender-affirming care is more than just medical interventions that commonly get referred to. It includes essential mental health services that people across the state provide to individuals to help them navigate their identity, to help reduce distress, and to improve overall well-being. As a psychologist, I provide therapy for people who are attempting to seek support in their gender journey, whether that is managing anxiety, depression, family, societal pressures, things of this nature. This care is not specific, I might add, to individuals who are on a specific type of gender journey. Many cisgender, which is a term that means I was born a certain gender and that gender has felt real and true for me. Many cisgender folks also engage in gender-affirming care. Though it can be for some, this type of care is not generally elective. It is life-saving. Research, again, from APA talks so much about access to gender-affirming mental health care as being so closely related to health services significantly reducing suicide risk and improving long-term healthcare outcomes. Psychologists, of course, are an integral part of gender-affirming care. We conduct assessments, provide therapy, offer support, collaborate, train, teach, research, and just in general collaborate with medical providers to ensure that comprehensive support is being addressed and taking place. Without protections like these outlined in SB 171, mental health professionals could face legal and professional risks. Here again, simply for following best practices that are legal in the state according to patient care. SB 171 is not about politics. It's about upholding Nevada's standard of care and protecting providers who follow best practices in medicine and mental health. Similar protections already exist for reproductive health care providers in our state, and this bill ensures that all providers, whether they're offering life-saving reproductive care or gender-affirming care, are treated fairly and can continue to serve patients without that undue interference. Furthermore, SB 171 aligns with Nevada's commitment to quality for healthcare. Similar protections, as I said, already exist, but we're just trying to offer equal protection here. So passing 171 in closing is hopefully going to send a clear message. Nevada values its healthcare professionals. It respects medical expertise, and it upholds the dignity and the rights of all patients. I urge you to support this bill. Thank you so much for your time.
Chair Pazina, if I may, we'll go to Rob Phoenix in Las Vegas, if that's okay.
Yes, please. And then we'll listen to your final Zoom speaker. Thank you very much.
Good morning, Chair. Members of the committee, my name is John Phoenix. My preferred name is Rob, and I use the pronouns of he, him, his, and they, them. I choose to use pronouns in support of my community. I'm a family nurse practitioner here in Las Vegas. I have been providing gender-affirming care since 2013. I am certified by the World Professional Association of Transgender Health Providers under the Standards of Care version 8 in 2023. I am providing testimony in support of SB 171 as a medical expert in gender-affirming medical care. The testimony does not reflect the views of any of my employers. It only reflects my view as a medical expert. Gender-affirming care is the care that is medically necessary and is defined as referral, counseling, medical and/or surgical services that respect gender identity or expression of the patient and are found by a competent medical professional to be medically necessary. The National Association of Insurance Commissioners define medically necessary care as necessary for and appropriate to the diagnosis, treatment, cure, or relief of a condition, illness, injury, or disease or its symptoms. Medicare defines medically necessary as health services or supplies needed to diagnose or treat an illness, injury, condition, disease, or its symptoms, and that meet the accepted medical standards. As highlighted in this bill, just the simple act of prescribing by a health care professional does not make this care medically necessary. Gender-affirming care can also be if I prescribe spironolactone for a cisgendered female with a medical condition called polycystic ovarian syndrome. That is a medication I would commonly use in transition care, as well as testosterone for a cisgendered male to support his low testosterone levels from a medical condition called Klinefelter's disease, which I use testosterone in support of my transmasculine patients. Currently, there are 27 states that have enacted laws that ban Americans from accessing life-saving, medical necessary, gender-affirming care. Nevada would be one of 17 states that protect providers. Sorry, I lost my page. Protect providers as well as individuals and families that are coming to Nevada to access care out of fear of prosecution from states that ban medically necessary health care. Ms. Zock and colleagues published in their article, LGBT Community Needs and Assessments of Sexual Health Clinics, a brief report on how internal and external barriers to care have deleterious effects on the health of LGBTQ individuals. When individuals are denied care, there's an abundance of literature that outlines the harm that is caused to the patient and the family. Organizations such as the American Medical Association, American Academy of Pediatrics, and the American Nurses Association have issued statements regarding the harm that exclusive policies towards gender-affirming care will have on our populations, specifically our gender-diverse youth. In addition, the American Psychological Association has published guidelines in support of psychological care for the transgender and gender-diverse individuals. For over 20 years, studies have demonstrated the highly marginalized experiences this community experiences and the higher rates of mental health needs and suicide. In 2022, Denise Rivera and colleagues published an introduction to Rivera's gender-affirming nursing care model, which is a middle-range theory setting an expectation for nursing to support gender-affirming knowledge and care practices within the domain of nursing to improve health based on the systemic bias and discrimination experienced by transgender individuals within the healthcare system. What I'm educating you today about is the well-documented history of the negative effects of denying access to medically necessary care, especially within a marginalized community such as the LGBT community. I can produce hundreds of pieces of peer-reviewed literature that continue to demonstrate the harm that policies like this have. I can also share with you numerous peer-reviewed articles addressing the educational deficits of healthcare providers and healthcare provider training programs regarding our failure to include this relevant training in our programs and how that contributes to the negative experiences marginalized communities experience. We can also support this medically necessary care with evidence-based guidelines from organizations such as the Endocrine Society and the World Professional Association for Transgender Health. Nevada already sits at the bottom of the long list for shortages of healthcare providers. Protections such as this bill will offer to providers and protections this bill offers to patients and parents are desperately needed. As healthcare providers, our goal is to provide evidence-based medical care. This bill allows us to do that safer. Our request for you as legislators is very simple. We are not asking you to step into the exam room with us to help in guiding decisions between patients and parents and providers. We are asking you to help protect access to the care by providing legislative protections for us to do our jobs, and that is to provide medically necessary access to gender-affirming healthcare. Thank you.
Good morning. I'm assuming I can go next.
Yes, please proceed and thank you.
Thank you. Good morning, all. My name is Gabby Doyle, D-O-Y-L-E, and I'm the Senior Manager of State Advocacy at the Trevor Project. The Trevor Project is the leading suicide prevention and crisis intervention organization for LGBTQ young people. The Trevor Project offers 24/7 crisis services, connecting highly trained counselors with LGBTQ young people whenever they need support. We also operate robust research, advocacy, education, and peer support programs. I'm here today to ask you to pass SB 171 out of committee, legislation that will protect providers and access to legal best practice healthcare for transgender people in Nevada. According to the Trevor Project's 2024 U.S. National Survey on the mental health of LGBTQ young people, 39% of LGBTQ young people seriously considered attempting suicide in the past year alone, including more than half of transgender and non-binary young people. LGBTQ young people are not inherently prone to suicide risk because of their sexual orientation or gender identity. Rather, they are placed at higher risk by the mistreatment and stigma they experience in society, including barriers to accessing essential best practice medical care. Fortunately, we know that access to transgender medical care can protect the lives of transgender young people. Transgender medical care for young people is associated with positive mental health outcomes, including showing promise for reducing suicide risk. In February 2022, the Journal of American Medical Association published new research that found transgender medical care for transgender teens was associated with 60% lower odds of moderate or severe depression and 73% lower odds of suicidality over a 12-month follow-up. For trans youth, this medically necessary healthcare is provided after extensive evaluation of a young person and their needs and in consultation with their parents on best practice age-appropriate treatment options. Best practice standards of providing transgender healthcare are not altered under SB 171. Access to this essential care was expanded last year to require insurance coverage, and enactment of SB 171 will ensure Nevada healthcare providers can continue to care for their patients, and families can continue to access this care that Nevada leadership has already ruled to be medically necessary. Passing SB 171 will be particularly impactful for transgender youth and their families who are already crossing state lines to access the care they need. It will protect providers who are currently left vulnerable and providing this care as aligned with their ethical duties to all patients who seek their care. It will also have the potential to alleviate significant barriers for care for trans youth and their families in other states who otherwise may have to travel hundreds of miles to get similarly protected best practice healthcare. Many of these youth in outside states are already at an increased risk of adverse mental health outcomes due to the bans on best practice medical care for transgender young people and additional discriminatory laws targeting LGBTQ young people. For these reasons, the Trevor Project supports the passage of SB 171 and encourages you to vote yes on the legislation to advance it out of committee. Thank you.
Thank you so much to all of our presenters this morning who made themselves available. We very much appreciate it. Do we have any more presenters this morning?
Chair Pazina, James Orenshaw, Senate District 21. No, those are all my co-presenters. I'm happy to answer any questions.
Thank you so much. All right, we'll start with Senator Rogich.
Good morning, and thank you for presenting today. This is a very complex area, especially when it comes to the minors, which we discussed a little bit the other day. And so if you could please explain and walk through at what age are the puberty blockers for transgender and gender diverse youth started?
James Orenshaw, Senate 21. Chair Pazina, may I defer to Rob Phoenix down in Southern Nevada, who's an expert in that area?
Thank you for the question. John Phoenix for the record, Phoenix. So puberty blockers don't necessarily go by age. They're based on a condition called Tanner staging. So based on an adolescent's puberty advancement, once they hit Tanner staging 2 is when we would consider when we would start having conversations with parents around the decision to include puberty blockers in their child's care. Puberty blockers essentially allow us to pause the natural progression of puberty for an adolescent while we explore the rest of their gender transition and what that might look like for the child.
We will have a follow-up. I just wanted to ask you a question really quickly, and it could just be that I'm maybe not understanding the bill as well. My understanding is this is more of a healthcare workforce bill and less of a bill on whether we agree with transgender services. Am I right or wrong in that assumption?
James Orenshaw, Senate 21, Chair Pazina. Senate Bill 171 does not change any state laws on what is legal in Nevada for healthcare providers to provide. It provides protection for healthcare providers from other states that have passed laws that have made illegal care that is legal in Nevada, medically necessary care.
Thank you. Just wanted to make sure I understood moving forward, and I thank you for the clarification. We'll go back for a follow-up question from Senator Rogich and then any further committee members.
Thank you. Getting an understanding of the area is why I had asked that question. With regard to out-of-state providers, and could you explain further how our state licensing board will ensure that the out-of-state providers are offering gender-affirming care that meets the standards of care and patient safety in Nevada?
Thank you, James Orenshaw, Senate District 21. Through you, Chair Pazina, to Senator Rogich. The healthcare licensing boards have a duty to make sure that any of their licensees are abiding by Nevada law and certainly not violating any laws or regulations of the state. The concern here, and what we try to address in Senate Bill 171, is that if we have a healthcare provider who has decided to move to Nevada, who may have provided gender-affirming care in another state that has passed one of these laws that have now declared that illegal, that would not prejudice their ability to practice here and to be licensed here based on medical care that is legal in Nevada. That alone would not be the reason. Very often, if a board hears that a doctor has been sanctioned or lost their license in another state, they review that. But here, what we are asking is that if that sole reason was for providing care that is legal in Nevada, that would not be the basis to not let that healthcare provider practice under the authority of one of those boards. Thank you.
Thank you so much. And in the future, you can go direct as well to the senator, and I appreciate the question. Senator Flores.
Thank you, Madam Chair. And I know you've alluded to this before, but I think maybe you can clarify it on the record again. And thank you again for bringing forth this measure. Does having a shield law in Nevada, bottom line, have a chilling effect for healthcare providers here in the state?
Thank you very much, Senator Flores. I've spoken to doctors and to residents who are studying to, move on to become doctors, who've told me that, if a state doesn't pass a shield law because they want to practice gender affirming care, they don't feel safe practicing in Nevada and will look to other states. So I feel personally that not having a shield law can have a chilling effect on attracting healthcare providers whose practices, may be limited to gender affirming care, may not be limited to gender affirming care. And I think that that's a cost that I hope the committee will weigh, because there are many excellent healthcare providers out there, many excellent students who want to become healthcare providers. And if they're fearful that if someone travels from a state that has passed one of the laws banning gender affirming care to Nevada, and they provide gender affirming care, and that other state may try to criminally prosecute them or may try to go after their Nevada license, to me, that creates a chilling effect, and that's what was expressed to me by doctors, by residents. And with your permission, could I defer to Dr. Chapelove if she's still here, and to Mr. Phoenix, if they're still available, maybe they could comment on, the effect on healthcare providers. Thank you, Chair.
Absolutely. Let's start with Dr. Phoenix. And I'm not sure. I believe, Mr. Wade, that you mentioned that Dr. Chapelove may have to hop off the call. So we'll start with Dr. Phoenix, and we would love to head to Dr. Chapelove if she's still present.
Chair, she is no longer with us.
That sounds so final. Thank you, broadcast. Dr. Phoenix.
This is John Phoenix, for the record. Just for clarification, Chair, I'm a family nurse practitioner. I'm not a physician. But as a nurse practitioner providing gender affirming care for 13 years plus here in Nevada, and as one of the first individuals to provide gender affirming care in the state of Nevada, this is something that concerns me on a daily basis, especially when I hear laws like Indiana, where they're going after providers in other states for providing gender affirming care for adolescents. In Florida, as an example, as a nurse practitioner, I could not prescribe testosterone therapy to somebody seeking care for gender affirmation, but I could potentially write that same dose of prescription testosterone for a cisgendered male who wanted to enhance his performance or wanted to use testosterone to supplement his low testosterone. So it's a very real concern that I experience on a daily basis, as what is an external force going to come in and try to do to destroy my practice, destroy my livelihood, and also impact negatively the health and well-being of the community that I love and identify with, the LGBT community and Nevada, which I call home.
Thank you so much, Mr. Phoenix. And I will say as well, and the committee knows this, I've been so invested in increasing our healthcare workforce in the state. We're working on graduate medical education right now. I think we're all trying to do everything we can to increase the workforce here. So anything that would prohibit that, obviously, is very challenging when we're already ranked near the bottom for healthcare workers per Nevadan. So that said, do we have any other questions from the committee? Senator Scheibel.
Thank you so much, Chair, and thank you so much to all of you for this presentation. And there's something that I just want to clarify on the record about kind of the origin of the SHIELD law, because this is a new practice. This is new that we're introducing SHIELD laws for medical providers across the country. And, I guess I'm just looking to see if I'm going to be a little bit long-winded here, but I think it's important just to make sure that we're all on the same page, that really the reason that it's even necessary or even contemplated to introduce a bill like this is because we're currently living in a constitutional crisis where states are attempting to expand their jurisdiction beyond their legal borders in ways that we have not seen in generations before us. If we were to analogize this to other conduct that is criminalized in different ways in different states, it would sound absolutely absurd because it is. For example, here in the state of Nevada, we have a certain limit on the amount of marijuana that a person can possess. It's 1 gram for personal use. In Colorado, it's closer to 5 grams for personal use. But we would never, ever contemplate going to Colorado and arresting somebody there for having 3 grams of marijuana because it is illegal here in Nevada. It's ludicrous, but that's exactly what other states are trying to do here in Nevada. They're trying to say that in Texas, we are going to ban the prescription of puberty blockers, and they're going further and saying that they're going to try to send their law enforcement agencies to Nevada to arrest Nevada doctors for prescribing puberty blockers here in Nevada, even though there is no law prohibiting their prescription here in Nevada. And so in an ordinary circumstance, we wouldn't even have to talk about whether or not Nevada would be involved in that person's prosecution. But because other state legislatures have absolutely lost their minds in passing bills like this, we have to respond in order to protect those providers who are practicing legally here in Nevada, to say to them that if those people who apparently do not understand how states' rights work or how the United States Constitution is structured are going to attempt to come to Nevada and threaten our providers for following our laws and not following their laws, we're saying to our providers, we're going to protect you. We're not going to participate in this nonsense, and we're not going to allow anybody else to come here and tell us how to practice medicine. And if it weren't for those other laws being passed in other jurisdictions, we wouldn't even have to have this conversation today and moving into the future. Is that an accurate summary of the state of affairs?
Chair, James Hornshaw, Senate 21. Senator Scheibel, you said it so well, and I think your analogy is just spot on. I mean, a lot of states prohibit a lot of things that are legal in Nevada, gambling, and if someone were to try to, from another state reach in here, I think we'd think this is crazy. What the heck is going on? But here we've got the same situation regarding healthcare and healthcare that's legal in Nevada, having another state trying to prosecute healthcare providers. So I hope that won't be the case in the future. But certainly that's the lay of the land right now with different state laws across the country. And I think that really expresses why a shield law like this is important.
And conversely, I want to clarify that Section 2, subsection 2 says that if that provider in Texas, while they are still in Texas, prescribes a puberty blocker against Texas state law, and then they come to Nevada, and Texas is able to procure a valid warrant for violating the law while they were in Texas, they will still be able to come to Nevada and extradite that healthcare provider back to Texas for violating the laws there because the crime was committed while they were still in the jurisdiction where the conduct is unlawful.
James Hornshaw, Senate 21. That's correct. Certainly, I think that the way it's written is meant not to interfere in the affairs of that other state, but to not have them interfere with our healthcare providers and their practices.
Do we have any other questions from the committee? Okay. We're a quiet bunch on Friday. All right, so we are going to thank the presenters on Senate Bill 171 and have them take a seat. And then we will invite anyone up to the table on Senate Bill 171, first in our physical locations and then over the phones, who'd like to testify in support of Senate Bill 171.
Good morning. For the record, my name is Brooke Maylath. That's BROOKE Maylath. I know I'm not a stranger to many of you, having represented the transgender community in the past, but today, as full disclosure, I am a state employee. I am here on my own time. I am not representing any organization. My comments here are representing only myself. First, this bill does not change anything about the delivery of appropriate, medically necessary, evidence-based health care, a standard desirable for everyone. Arguments against this bill about that kind of care are utterly irrelevant to this bill. The lack of a shield law affects all in this room. In this state, pediatric panels average 1,546 patients. A primary care providers panel averages 2,800 patients. Obviously, if they treat 1 or 2 transgender patients, if you are taking them away and jeopardizing their license, you are taking them away from thousands of other cisgender patients. And those patients could include you. They could include your grandchild, your child, your family, or your constituents. This is a threat to all of us in this state. These extra-jurisdictional threats are very real and need to be stopped. Last, do not relinquish the power of the Nevada Legislature or the executive branch to the tyrants of Texas, Idaho, and other states. This will inhibit our ability to retain and recruit providers that we desperately need to this state. So please stand strong and support this bill. Thank you.
Good morning, Madam Chair, members of the committee. Leah Cartwright, LEA-CARTWRIGHT, here today on behalf of the Nevada Psychiatric Association. I do have some prepared remarks, but I may go off script just a little bit here, given the comments we heard from the committee earlier. I do want to say that today is match day for all physicians. This is the day when they get to know where they're going for their residency. And some of you may have seen I had 20 to 30 psychiatry residents in the building with me yesterday. They are practicing medicine here in Nevada. We love to see it. There are many, many residencies going unfilled in those states that have been identified as not allowing the full practice of medicine, right? We've seen that in Idaho. They filled 0% OBGYN residencies. The practice of psychiatry similarly is likely to see these folks who are coming in requesting gender-affirming care. The American Psychiatric Association, the American College of Pediatrics, this is all evidence-based, established medicine, and our providers here in Nevada should be able to do this work and provide this care to patients without fear of those external threats. Additionally, the reciprocal licensing requirement in subsection 4, really positions Nevada as a supportive and welcoming environment to all types of healthcare practitioners and encourages a diverse healthcare workforce in our state. So with that said, the Nevada Psychiatric Association stands in full support of SB 171. Thank you.
Thank you, Madam Chair, and thank you to the committee. Thank you, Senator Orenshaw, for doing this. My name is Kimmy Cole. That's Kimicole. Been a Nevada resident since 1956, and I transitioned about 15 years ago. It still kind of blows me away that we're still having these conversations these days, but we have to have them. And in those 15 years, I've gone on about life facing the same challenges as many people do. I treat people with respect, I obey the law, and I pay my taxes. If that is somehow in any way offensive to anybody, I'm not even going to apologize for it. We've gone far enough in this. And then I'd also like to say, a couple of the places that I feel really need to be just safe, off limits for anybody to get in and interfere, is I want my conversations with my doctor to be private. We will make decisions. They know my medical record. They know my history. They know how all of my body is functioning. They give me the best care for the best quality of life. And I also like to have my privacy in the restroom. And I hear arguments about who's doing what, who's doing this or that or anything like that. too many people are making way too darn many things up because they heard it on the news, and real people are getting hurt. We are 0.5% of the population, if that, and I don't particularly like or appreciate being singled out, like somehow after 15 years and a long time of living in Nevada, all of a sudden, you know, I have to start putting up with this stuff in my golden age. I hope the golden years stay good. We're here to keep working. I appreciate all the work that everybody's doing. But hey, let's go on about life. There are more important things in this world. Thank you.
Hello, committee members. My name is Sarah Lindstrom, Linds. I support SB 171 and ask for your support in it also. Endocrinologists are especially vulnerable to hostile states seeking retribution for doctors who are simply providing their communities the care they require. I currently am seeking an endocrinologist in the Reno area to help me with my thyroid and hormone levels as I go into perimenopause. I also have a transgender child who is seeking pediatric endocrinologists in our area. We don't have them. We have so very few for the community that I have had to go to California, to Stanford, to get the care for my child that that he needs. And I also am afraid that if we don't protect our doctors here in our state, that I will lose the availability that I need for my care as I move in to the later part of my life. I am asking for your support in supporting our doctors for SB 171. Thank you.
Good morning. My name is Rachel Grimm, Grimm, and I'm here in support of SB 171. As a parent, it's my job to support my child as they develop and figure out who they're going to be in this world. And that takes a lot of empathy. Empathy for things that I may not have any personal experience with. When my 10-year-old, who I had only known as a little girl, had the courage to share that he was more comfortable and wanted to live life as a boy, I had no idea what to do. To be honest, I don't understand gender fluidity or dysphoria because I've never had to think about it. I was born female, I look, sound, act, and most importantly, I feel female. I have no personal experience here. But fortunately, empathy doesn't require personal experience. It only requires us to believe someone else when they share their lived experience. I also don't understand organized religion, but that doesn't mean I don't believe someone when they share the strength and support that it offers them. And I would never want to block access to that just because I don't understand it. I would guess that there are parents on this committee who can relate to that moment when life throws you a curveball and your child suddenly needs something that you've never had to think about before. It's in those moments that we need access to care, resources, and providers who can help us have open conversations about care for our child. In order to have that access, those providers need the same protection that other doctors are afforded. The last thing I want my doctor thinking about when we're navigating care for my trans child is a fear of prosecution. Mental illness and suicide are not high among this group because of their gender identity. It's because they don't feel supported or even allowed to be who they are. And knowing that your doctor could go to jail for providing you health care sends a pretty clear message, doesn't it? I'm not asking any of you to understand why this matters to my child or to this community. I am only asking you to tap into your empathy and believe our lived experience, and please support SB 171. Thank you.
Good morning, Chair Pazina and Committee on Commerce and Labor. For the record, my name is Cal Boone, C-A-L-B-O-O-N-E. I'm also a member of a state agency, but I am not speaking on their behalf. I'm speaking as a private citizen. As someone who is Native American from the Walker River Paiute Nation and part of the LGBTQ+ community, I'm in strong support of Senate Bill 171, which is a vital step toward protecting the transgender community and the providers who care for them. To better understand why this bill is so important, it's helpful to recognize the distinctions between key aspects of identity, such as gender identity, expression, and sex assigned at birth. Gender identity refers to a person's internal sense of their gender, whether that's male, female, both, neither, or somewhere on the spectrum. Gender expression is how someone outwardly expresses their gender through appearance like clothing, for example. Sex assigned at birth is based on physical characteristics like chromosomes and anatomy. I share that because these are all distinct aspects of a person's identity, and they may or may not align with each other. This is important because of many things, but I want to close with a quote from the Human Rights Campaign, which I believe says it best. Gender-affirming care is age-appropriate care that is medically necessary for the well-being of many transgender, non-binary, and gender-expansive people who experience symptoms of gender dysphoria or distress that result from having one's gender identity not match their sex assigned at birth. Please support SB 171. Thank you.
Thank you so much to all of our speakers here in Carson City. We are now going to move to Las Vegas for those in support on Senate Bill 171. We will, after that, move to the phones.
Good morning, Madam Chair and members of the committee. Leanne McAllister, Leann McAllister. I serve the 288 pediatrician members of the Nevada chapter of the American Academy of Pediatrics as their executive director. My members are dedicated to the health of all children. My members live and work in the state of Nevada, and my members vote in the state of Nevada. SB 171 shields Nevada pediatricians and other licensed healthcare professionals from laws made in states where they do not live, practice, or vote. What's more, in my role at the Nevada AAP, I am privileged to work with wonderful medical students throughout our state. Medical students, particularly those entering pediatrics, often prioritize factors like access to care for vulnerable populations, reproductive rights, and LGBTQ+ healthcare. These issues often drive the best students away from states who do not respect evidence-based medicine. Thank you.
Good morning. My name is Ada Fuji, EIDA FUJII. And I'm here today as a mother in support of SB 171. I want to speak from a place no parent should have to want to be in. The truth is simple and painful. I was faced with either burying my son or gaining a daughter. Bearing a son was not a choice for me and should never be a choice forced upon any parent or child. My daughter is alive today because she had access to the gender-affirming care she needed. This care did not harm her nor confuse her. It saved her life. Without it, I have no doubt I would be mourning my child instead of speaking with you today. It gave her the ability to feel whole, confident, to be who she was meant to be, and most importantly, to want to live. Denying access to this care is not just a policy disagreement. It is life or death for families like mine. And how many more will take their own lives because they are denied the right to exist as themselves? SB 171 is about protection for the courageous physicians who provide this life-saving care to the lives of those who would not survive without it. I am forever grateful to those doctors and providers. Their compassion and expertise saved my child, my daughter. I urge and plead with you to pass SB 171 and to protect the providers and stand on the side of life. Thank you.
Good morning, Chair Pazina, Vice Chair Daly, and members of the Senate Commerce and Labor Committee. For the record, I'm David Parks, P-A-R-K-S. Without being redundant, I would simply like to voice my strong support for passage of Senate Bill 171 and sincerely thank Senator Orenshaw for introducing this bill, which establishes a law protecting licensed medical providers who provide medically necessary gender-affirming health care. Thank you for the privilege of your time.
Thank you, Senator Parks. You were missed up here in Carson City, and we hope to see you again. And we also thank the speakers who shared their personal stories here in Carson City as well as in Las Vegas. And with that, we are going to move to the phone lines in support of Senate Bill 171.
If you would like to testify in support of Senate Bill 171, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 405, please press star 6 to unmute yourself. Thank you. Please begin. Caller, we can see you're unmuted on our end. Is it possible you're muted on your end? Can you try again?
I believe I am unmuted.
There we go.
Do you hear me?
Yes, we can.
Okay. Good morning, committee members. My name is Mark Hilty, H-I-L-T-Y. I support Senate Bill 171 and urge you to support it as well. I am a retired firefighter living in Reno. My wife and I are parents to 2 transgender young people, ages 15 and 22. For the past 9 years since our eldest came out, Ruth and I have had to educate ourselves on transgender issues and how they affect both the physical and mental health of our child. This personal journey and advocacy took on an even greater importance after our second child came out 3 years ago. We found out early on that there are very few licensed medical practitioners in Northern Nevada who are specialized and well-versed in providing gender-affirming care to pediatric transgender patients. Because demand for these services is high in our area, while the pool of providers is low, both of our children have spent an inordinate amount of time languishing on waiting lists, hoping for a future opening with a qualified provider. As a result, both of them have received treatment and related medications beyond the optimal time frame for their bodies to accept them. During these gaps in physical and mental care, Ruth and I have noticed a decline in the wellness and outlook of both of our children. As a family, we are thankful that the state of Nevada seems to deem that the work of these specialized providers is valuable and has not criminalized them as other states have. Please support Senate Bill 171 so that these medical professionals can do their jobs without the added pressure and burden of possibly losing their livelihoods and potentially being incarcerated. Thank you all for your time this morning.
Hello, Chair and members of the committee. My name is Amber Falgo, A-M-B-E-R-F-A-L-G-O-U-T. I am the Communications Director with Battleborn Progress. I am calling to express our support for Senate Bill 171. We believe providers should be able to practice without fear of losing their license or facing professional sanctions merely for providing life-saving medically necessary care to transgender patients. All Nevadans expect confidentiality when discussing their health care with their provider. Transgender individuals deserve the same assurance that their health care decisions remain private and protected. By strengthening these protections, SB 171 reinforces Nevada's commitment to patient-centered health care, just like the protections they have with other health data. We urge the committee to pass this measure. Thank you for your time.
Caller with the last three digits of 358, you are unmuted. Please continue.
Can everybody hear me?
Please proceed.
Yes, we can.
Cool. Good morning, Chair and members of the committee. My name is Riley Svensson, RYLEY SVENDSEN, and I am the policy specialist with the Nevada Coalition to End Domestic and Sexual Violence. According to the most recent human rights campaign on the violence that affects the transgender community, 1 in 4 transgender victims were killed by an intimate partner, and 1 in 10 were killed by a family or friend. A study at UCLA showed transgender people are over 4 times more likely than cisgender people to be victims of violent crime, including rape and sexual assault. Gender-affirming care is critical in both protecting the trans community and living a life of dignity. Protecting the providers of gender-affirming care is necessary to ensure that such care is available and accessible to all Nevadans. It has consistently been shown to improve the quality of life, improve health outcomes, and reduce the rates of sexual assault. Ensuring transgender people have access to gender-affirming care is a critical step in preventing intimate partner violence and sexual violence towards the transgender community. For this, we urge you to support SB 171. Thank you.
Good morning, Chair Pazina, Vice Chair Daly, and members of the committee. Senator Daly is actually my representative here in Senate District 13. My name is Bree Schmidt, BRISCHMIDT, and I'm a lifelong resident of Reno, Nevada, urging you to support SB 171. I am a program associate with Silver State Equality, but today I'm speaking in my personal capacity. As a trans person, finding healthcare providers in Nevada who not only affirm my identity, but are able to provide the care that I need feels impossible at times. I believe the committee would be hard-pressed to find a Nevadan who hasn't struggled to find a doctor for necessary medical care here. Over the past year, I've worked with one of my doctors to pursue gender-affirming care. We took a full year to try non-surgical options, different medications, and spend time reading research to find an option that worked for me. Finally, in January, I received a surgical procedure that has been so affirming and vastly improved my day-to-day existence. But with the uncertain times we live in, if my doctor had been any less brave, or felt any less supported by Nevada laws, or felt under threat from other states, I would not have been able to receive this necessary care. SB 171 will increase access to healthcare for all Nevadans, regardless of their gender identity, and it will help healthcare providers in Nevada to feel empowered to trust themselves and continue to engage in best practices without fear of punishment from other states. Thank you.
Caller 795, you are unmuted. Please continue. Caller with the last 3 digits of 795, we can see you are unmuted. Is it possible you are muted on your end? Chair, I will switch to the next caller and come back to them.
Good morning, Chair and members of the committee. My name is Lorelei Williams, LORILEIWILLIAMS. I am a pregnant transgender non-binary person. I work as a human rights attorney specializing in migration and LGBTQIA2S+ issues. I currently live in Las Vegas after having recently fled Texas as a transgender pregnant person. I'm here to testify in support of SB 171 to ensure access to gender-affirming care continues to be protected in Nevada by shielding licensed providers and Americans from prosecution and discipline from states like Texas that ban medically necessary health care for providers and patients. SB 171 is an important shield law that protects health care for all Nevadans. Nevada faces an unprecedented healthcare workforce shortage, and SB 171 offers a solution to this critical shortage by creating a healthcare environment that protects current providers and attracts new ones. Further, decisions about healthcare are deeply personal and should remain between patients and their providers, free from political interference and external threats. By protecting providers, Nevada ensures patients, including new expecting parents like me, have access to the full spectrum of healthcare services we need. Gender-affirming healthcare is a serious decision that no one takes lightly, especially transgender people like me seeking the support from medical experts, and has proven time and again to improve health outcomes of transgender people like me by ensuring our rights are protected and our identities affirmed during a time of unprecedented attacks on transgender people. Thank you.
Good morning, Chair and members of the committee. My name is Jenny Stepp, Jenny Stepp, and I'm a licensed clinical professional counselor in private practice in Las Vegas. I specialize in mood and anxiety disorders, trauma, and PTSD. I'm the Vice President of the Nevada Board of Examiners of Marriage and Family Therapists and Clinical Professional Counselors. I also serve as the Healthcare Action Team Chair for the Nevada chapter of the National Organization for Women. I am testifying today on my own behalf as a mental health counselor in support of Senate Bill 171 because I'm proud to be part of the Nevada workforce, providing evidence-based, ethical, and compassionate mental health care to my community. Simply put, gender-affirming care is suicide prevention. The data and statistics are so clear. Gender-affirming care significantly reduces suicide risk by alleviating the distress caused by gender dysphoria, improving patient mental health, and fostering a sense of identity and belonging. Furthermore, Senator Scheibel spoke so eloquently today about a point I want to make. I want to share a concerning trend I'm witnessing as a mental health counselor. I'm seeing increasing numbers of burned out, exhausted, and traumatized healthcare providers in my office who are fearful and concerned about losing their ability to practice evidence-based medicine and life-saving medical care. In a time when we are facing a provider shortage, Senate Bill 171 would protect, recruit, support, and retain a healthier workforce and uphold Nevada's commitment to being a leader in healthcare. Let's protect our healthcare workers who serve and treat our community. Thank you.
Thank you so much. Broadcast will take 5 more callers in support. We will come back to them at the end if there's more remaining. And also a reminder, we thank everyone so much for their testimony and have appreciated all of it. If you are in agreement with someone also, it's okay to say ditto. And there is a 2-minute limit for testimony. Broadcast?
Caller with the last 3 digits of 965, you're unmuted. Please continue.
Good morning, Chair and members of the committee. This is deeply emotional for me. My name is Jacqueline Bondi, and I am in support of SB 171. I am a state of Nevada agency employee, but the views that I express are strictly my own. As Nevada faces an unprecedented healthcare provider shortage, it is imperative that we offer protections to shield physicians providing life-saving, gender-affirming care. This care is legal in Nevada and it's covered by insurance. Apologies. As a mother of a transgender child, I hope this bill is passed and we are not forced to pursue gender-affirming care in other states or in the extreme end of this spectrum, fleeing the United States. I would love to be talking about other things with my child besides worrying about their physical and mental health. Thank you for hearing my testimony today.
Hello, can you hear me?
Please proceed.
Good morning, Chair and members of the committee. My name is Pauline Russert Schwartz, RUSERT-SCHWARTZ, and I'm just calling as a citizen. I am in support of SB 171. This bill is more important now than ever, given
our current national political environment. It's important. This bill is important not only for the rights of trans people, but for the doctors and people who provide their care, for people who protect and stand with them, as well as for cisgender people who may need gender affirming care. And I really want to make that point because there are so many people who may not be compassionate toward transgender people. So at the very least, think of the rights for your own self. And you may not even realize what kinds of care would be covered under this that affect all kinds of people. Thank you so much for your time.
Good morning, Chair, Vice Chair, and members of the committee. I am Dr. Regina Marshall, REGINA Marshall. I'm a licensed psychologist providing care in Nevada. I am speaking on behalf of the Nevada Psychological Association in support of SB 171, sponsored by Senator Orenshaw. The Nevada Psychological Association supports SB 171, which provides protections for healthcare workers engaging in gender-affirming care within the state of Nevada. This bill aligns with the ethics and values of the psychology field by engaging in supportive, affirming care for transgender and gender-diverse folks without the fear of repercussions for providing safe and evidence-based care. Discrimination and a lack of access to care for transgender and gender-diverse people results in poor physical and mental health outcomes, suicide, poor academic and workplace engagement, and increased healthcare costs. Further, this bill aligns with the value of Nevadans as outlined in our state constitution that rights not be curtailed due to engaging in reproductive health care, which was signed into law in 2023 by our current governor. We ask for your support on this bill. We submit a letter of support with additional information. For any questions, comments, or further discussion, please do not hesitate to reach out to myself or the Nevada Psychological Association. We thank you for your time and consideration.
Thank you so much. BPS, we will take one more caller right now in support, and then, of course, we'll come back at the end if there's anyone else waiting, but just to keep moving the hearing forward, is there an additional caller in support?
Hello?
Yes, caller, please continue.
Okay, my name is Sakura Nishikawa, Sakura Nishikawa, and I'm here to support SB 171. I would like to thank Senator Orenshaw and Senator Seibel, and also the Service Equality for doing this. I'm a transgender woman who's been living in Nevada since at least for 20 plus years, and I transitioned at least for 2 years, and I'm very proud of my doctor who gave me this treatment and giving me a new life to give me kindness and support. I couldn't live to this day because it's medication that is helping, and to the youth who deserve it, and we need doctors protected to this day because there's prosecution by this our Trump administration. What are they doing for it? With misinformation has coming up. So I like to, would like to have our doctors be protected because it is, by the APA and the World Health Organization proven that it is a life treatment, and the Mental Health Society. So please support SB 171. Thank you.
Thank you so much. We'll come back at the end for each part if there's time, but right now I am going to move us into opposition of Senate Bill 171 and our physical locations, and then we'll move to the phones.
Good morning, Madam Chair, members of the committee. My name is Janine Hansen. I'm the state president of Nevada Families for Freedom, and I am the grandmother of 18 grandchildren. We continue to have concerns that SB 171 violates the U.S. Constitution in the extradition clause, Article 4, Section 2. Senator John Calhoun of South Carolina expressed in the U.S. Senate his opposition to tariffs that were passed in 1828, and he declared that the state didn't have to follow federal law because the state had authority to oppose that. Senator Henry Clay made eloquent opposition to that, in that he said if this was allowed to happen, that it would cause the dissolution of the Union. Ultimately, this question went on for years. They did try to ameliorate that problem, and even after the Missouri Compromise, what had happened was that this philosophy of states being able to ignore federal law did result in the U.S. Civil War. This doesn't just violate state law, it also violates the Constitution, which we continue to be concerned about. Jamie Reed and I shared this with the committee secretary, pediatric transgender center at Washington University. She worked there. She was a lesbian. She worked there for 4 years. She decided to file a complaint with the Missouri Attorney General. She says, I have decided to come forward to report serious concerns I have about the medical care being provided by the center, a transgender center, causing harm to patients and their families. This includes the rapid medicalization of children, poor assessments of medical health concerns prior to the provision of gender-altering treatment, medicalization of children without prior and adequate therapeutic treatment, lack of appropriate informed consent by parents and youth, and actual permanent and irreversible harm and injury caused by medical treatment provided by the center. I have one sentence.
Okay.
SB 171 will make Nevada a magnet for these type of physicians. Thank you.
Tanya Freeman, I'm a trans woman. I agree with portions of this bill, and I disagree with other portions of this bill. Prohibiting or causing an issue with their governor extraditing an individual who has committed a crime in another state. It's my belief that this could be misconstrued and misused by others. I can support a good portion of the bill, but I do not support the extradition part of it. There needs to be some modification there.
Good morning, Chair and Committee. My name is Joshua Skaggs, and I am the Legislative Affairs Director for the Nevada Republican Party, today in opposition to SB 171. Our platform states we oppose medical treatments such as puberty blockers, cross-sex hormones, and surgeries that will sterilize or adversely affect the health of minor children. SB 171 is an attempt to repass SB 302 of the 2023 session, which was vetoed by the governor. In his veto statement, the governor noted that the problem with the bill was that it inhibited the executive branch's ability to be certain that all gender-affirming care related to minors comports with state law. It also decreases the executive branch's authority to ensure the highest public health and child safety standards for Nevadans. Despite the sentence on parental or minor consent added in Section 1, the remaining language in Section 1, subsection 2, remains unchanged from the previous bill and makes it clear that the bill continues to be targeted to procedures performed on minors. Section 2 of SB 171 continues to inhibit the executive branch's ability to protect Nevadans, particularly minors facing permanent life-changing procedures without their consent from being victimized by bad practitioners. We believe that SB 171 violates common sense as well as the extradition clause, Article 4, Section 2 of the U.S. Constitution, which requires states to deliver up fugitives from justice to the state where the crime was committed. As we did in the last session, we urge a no vote on this dangerous legislation. Thank you.
Okay. Not seeing anyone in Las Vegas broadcast. Let's move to the phones for those in opposition of Senate Bill 171.
If you would like to testify in opposition of SB 171, please press star 9 now to take your place in the queue.
CYRUS HOJJATY. I stand in opposition. I will ditto the comments. Thank you so much. Yield my time.
Hi, my name is Katrin Ivanov. In the political circles, I'm known as Mrs. Fix-It. And this bill doesn't fix anything. It only creates many, many, many problems to come. When kids are minors, parental consent on things is not enough. There is parents that abuse their kids, and then the government steps in, takes it away from them, and protects them. So only because the parent gives permission to the child to do what they want is not a good enough reason. There should be medical reasons to do things, and stopping of your healthy organs to the point that you can no longer have future population is not the proper way to do things. If any adult wants to do that, it's their body, their choice, I don't care. But kids, keep your hands off the kids. Why is the government wants to take the parental role? Why is the government want to tell people what to do all the time? Please, use common sense. This is ridiculous. And you already tried to pass that bill. There should be some kind of a rule that you can't be presenting the same bills session after session after session until people get tired and get passed. If the bill doesn't pass, move on. Do something else. Don't give it another name and dress it up with a little bow and put it on again. This is not nice, what you guys are doing. I hope that you can hear everybody, and I hope that you listen to normal experts. Thank you, and I agree with everything everyone says for the no, and just if I'm not clear, please vote no on SB 171. Have a lovely day.
Good morning. Excuse me. Chairwoman and committee, my name is Lynn Chapman. I'm the state treasurer of the Independent American Party. What people do when they are 18 years and older is their business. However, the state of Nevada has a duty to protect its citizens. We do need doctors to come to Nevada and practice medicine, but the state of Nevada has a duty to protect its citizens. A doctor who performs surgeries in another state and that state ends up having charges filed against that doctor should not be able to come to our state and be protected. What kind of doctors will we end up having in our state? Very concerning to us is that this bill prohibits the governor from extraditing a criminal or an alleged criminal. Our governor was elected to make sure we as Nevadans are protected. Section 3 discusses the fact that Nevada will not be permitted to expend any resources in the furtherance of investigations initiated in or by another state. Sure hope we don't need other states to help us when we need it. The people of Nevada elected the governor and expect him to be able to do his job. Stop trying to tie his hands so he can't do the job he was elected to do. Nevadans don't need this bill. Vote no on SB 171. Thank you.
Good morning, Madam Chair and members of the committee. This is Bob Russo, RUSSO for the record. I oppose SB 171 for several reasons. First, this bill will allow incompetent gender-affirming care doctors who have been charged with crimes in other states to flee to Nevada to avoid prosecution. Do we really want Nevada to be a sanctuary state for incompetent doctors? Additionally, these same doctors could set up shop in Nevada and go about their business, risking the well-being of our children and youth who have been misled to believe that gender-affirming care will somehow magically improve their lives. Sadly, many have found out the hard way after their bodies have been mutilated and rendered infertile. It's a very sad situation, in my opinion. This bill also ties the governor's hands in extraditing those doctors who have fled to our state to avoid prosecution. This violates Article 4, Section 2 of the U.S. Constitution that demands that extradition of fugitives who have committed crimes in other states. In the original language of the Constitution, the word shall on demand makes it noticeably clear that the governor is responsible for extraditing individuals who are wanted for crimes in other states. This bill attempts to prevent the governor from taking such action. Lastly, it would also prevent state agencies from assisting in another state's investigation of individuals charged with crime associated with gender-affirming care. And it's for these reasons that I oppose this bill and ask you to please do the same. Thank you very much.
Hello, my name is Lorena Biasotti, and I am speaking for myself. I agree that trans people need doctors, but not gender-affirming doctors. They are in dire need of mental health. And as you can see, and as kind as you believe you're being, you're aiding in the destruction of themselves. I would like to read an excerpt from a report from the National Institute of Health concluded in 2023 and just recently got published. It is titled, Risk of Suicide and Self-Harm Following Gender Affirmation Surgery. The abstract introduction states, with the growing acceptance of transgender individuals, the number of gender affirmation surgeries has increased. Transgender individuals face elevated depression rates, leading to an increase in suicide ideation and attempts. This study evaluates the risk of suicide or self-harm associated with gender affirmation procedures. It goes on to explain the methods used, databases that involve 56 United States healthcare organizations and over 90 million patients. The study involved 4 cohorts from ages 18 to 16. The results. Individuals who underwent gender affirming surgery had a 12.12-fold higher suicide attempt risk than those who did not. Compared to the tubal ligation vasectomy control, the risk was 5.03-fold higher before propensity matching. The conclusion states, patients who have undergone gender-affirming surgery are associated with a significantly elevated risk of suicide, highlighting the necessity for comprehensive post-procedure psychiatric support. As you can see through testimony, people are suffering emotionally and psychologically. They need help. We have doctors to help them. We do not need doctors who are willing to betray their oath and damage them even further. Legislators, this report will be sent to you. It is factual. Vote your conscience. Thank you.
This is the mic.
Please continue, sir.
Okay, this is Tim Underwood. I'm a board member for Moms for Liberty, grandfather of 5 that are here in Southern Nevada, subject to the Clark County School District, which currently gender-groomed school children. They also keep sexual secrets from school parents and have over 300 students being supported by school intervention to castrate themselves, currently on formal gender plans. I am also a father of a son who took his life after following WPATH standards of healthcare for transgenderism. Transgenderism for children and vulnerable adults as prescribed by modern standards such as those of the World Professional Association of Transgender Health is the biggest medical scandal in history, and the Nevada State Legislature fell for it hook, line, and sinker. By enacting several laws over the past several years, this legislative body has participated in this scandal that essentially coerces children and vulnerable adults to castrate themselves. SB 171 only deepens the medical scandal by attempting to erect a 2-tier justice system for child and adult castrators, something deeply repugnant to common sense, medical science, and the working class family who make up 80% of your constituents. The WPATH files, a set of leaked documents and videos from a WPATH whistleblower
exposes the organization for not relying on any scientific experiments or medical studies. I've submitted the documents and videos to this body for your review. In the United Kingdom, they have essentially forbidden gender-affirming care for minor children, largely because of the CAS report on transgender health care, an independent review of gender services for children and vulnerable adults commissioned by the National Health Service England in 2020 to examine gender identity
Okay,
services
thank you so
in the
much.
UK.
That's 2 minutes. So if you have any comments you'd like to provide in writing to the committee secretary, please do so. As a reminder for all future callers, you are more than welcome to say ditto. Also, pursuant to Nevada Revised Statute 218E.085, it's unlawful for a person to knowingly misrepresent facts when testifying in a hearing before a committee, and a person who knowingly misrepresents facts before a committee is guilty of a misdemeanor. With that said, we welcome, I believe we have a few more callers who are in opposition. We welcome them at this time, and remember, we do have a 2-minute limit, and welcome ditto.
Good morning, Chair Pazina and committee. My name is Jim DeGraffenreid, JimDeGraffenreid, and I am Nevada's Republican National Committee man here in opposition today to SB 171 on behalf of the Nevada Republican Party. At its core, SB 171 is an unneeded political statement. No other state is prosecuting doctors for performing legal procedures in Nevada that might be illegal in that state. That would be the equivalent of a state where gambling is illegal, attempting to prosecute a resident of that state for gambling while on vacation in Las Vegas, or to prosecute a casino for allowing an out-of-state resident to gamble here. Examples were given today of inappropriate attempts by Texas and other states to prosecute actions taken elsewhere, but as was mentioned, these efforts have been correctly shut down due to states' recognized rights to control the actions within their borders. On the flip side, though, especially since our permissive laws are in a minority among the states, Nevada should not attempt to extend our authority beyond the Nevada state line either, which is exactly what this bill attempts to do. At best, SB 171 is an unnecessary statement, but at worst, it enables bad doctors who cannot be licensed in their home states to practice medicine in Nevada. We oppose it either way. We oppose Senate Bill 302 in 2023, and Senate Bill 171 doesn't address our objections or the objections raised by the governor in his veto. Accordingly, we urge the committee to not support this unconstitutional and dangerous bill. Thank you.
Good afternoon, members of committee and chairwoman. My name is Christiane Mersch, last name M-E-R-S-C-H. I'm the founder of the chapter of Moms for Liberty Clark County, Nevada, representing thousands of families across the state. And we are here in opposition, or extremely opposed of this bill. It's sad that we haven't to oppose this again because this bill under SB 302 was vetoed last legislative session by your governor. Is a waste of time. Nevada needs so much on education, so much in our economy, and here wasting our time of this bill again. In brief, veto message last session, Lombardo wrote he could not support this bill because it inhibits the executive branch's ability to be certain that all genders affirming care related to minors comports with state laws and decrease the executive branch's authority to ensure the highest public health and child safety standards for Nevada. So that was his statement. Also, President Trump did an executive order banning chemical surgery in minors because this is not gender-affirming care, this is child mutilation. Let's gonna put clear words here. There's no such thing as gender-affirming care for kids. This is child mutilation and sterilization, and they regret. Well, you hear the word suicide a lot. Well, they get suicide rates after they go through this treatment because kids don't know what is best for them. Kids cannot vote. Kids cannot have weapons. So why they're going to have this decision? We need to protect our children. We cannot be a sanctuary state for this kind of procedures here. We Nevadans deserve better, and our families deserve better. Also, I want to highlight the last testimony of Tim Underwood. He did lose his son because his son did the transgender surgery, and he died by suicide because he was not happy with that. So we are here extremely opposed. There's so many cases. Please vote no. We urge you vote no. Follow your conscience. Follow what the people of Nevada want.
Thank you so much for your testimony. Okay. If there's any further comments, make sure to turn them into our committee secretary. And with that, I believe we have one more caller in opposition.
Hello, my name is Michael Ryan, MICHAELRYAN. I'm a longtime resident of Nevada and a Marine Corps veteran. Please vote no on Senate Bill 171. I am in total disagreement with this horrible bill. Do not make Nevada a sanctuary state for gender-affirming care from doctors who have violated the laws of other states. These doctors are criminals. This is insanity. I also oppose this bill because it restricts the governor's constitutional authority to extradite criminals who have fled to our state. Please vote no on SB 171. Thank you.
Okay, thank you so much. With that, we are going to move to neutral on Senate Bill 171. Seeing no one coming to the tables in neutral in either Las Vegas or up here in Carson City, we will move to the phone lines for those in neutral. Again, those in neutral only.
If you would like to testify neutral on SB 171, please press star 9 now to take your place in the queue. Chair, you have no callers wishing to testify neutral at this time.
Thank you so much. Because testimony was so popular and more people joined throughout, we will give an opportunity for 2 more to testify in support and 2 more to testify in opposition. If they're already on the lines, broadcast will start with support if there are 2 more callers online who wanted to testify in support of Senate Bill 171.
If you would like to testify in support of SB 171, please press star 9 now to take your place in the queue. Again, if you would like to testify in support.
Hello, this is Melissa Washaba, MELISSA, and I would like to testify in support of SB 171. I have a prepared statement, but first I wanted to just mention, listening to opposition testimony, that the bill very clearly states in Section 2, Item 2, that this does not apply to any laws that were broken in another state. It only applies to things that doctors are doing within this state. So the extradition arguments that we've heard, I believe, are misinformed or do not apply to this specific bill. But I would like to read some prepared testimony as a psychiatric nurse practitioner who's working in rural areas. I would like to say that I support this bill to ensure freedom of medical practice without the threat of prosecution under the laws of other states. This bill is specifically worded to protect transgender care provided within this state and allowed under the laws of this state. The bill should not be necessary, as matters of medical licensing and malpractice are typically handled within the state that the service is provided. However, with the recent political extremism within the country, there have been pushes to extend the jurisdiction of one state's enforcement into another state's practice autonomy. Although I'm sure that you've heard many arguments about protecting the transgender community, I would also like to argue from another important angle of the proposal. If we were to allow prosecution of our medical professionals for providing care to patients located within the state that is legally allowed in the state, the consequences and difficulties of this precedent would be severe. For example, I am a nurse practitioner licensed to practice without physician authority per Nevada law. If the president were said that I need to abide by the laws of the patient's home address, I could easily be in violation just by seeing a patient, as many states still require a collaborative agreement with a physician for my job. Should I be subject to discipline for practicing within my own state's licensing laws because the patient I treated is in my community for a temporary job but has a home in another state? Consider the out-of-state travelers visiting emergency rooms or urgent care centers, or those who live here part of the year, those fleeing natural disasters, families with split custody, active military. There may be many reasons you seek healthcare outside of your home state. It is not every healthcare professional's responsibility to treat patients differently depending on their
We
address.
thank you so much. It has been 2 minutes. So if you want to finish up your comments and provide anything
Thank
else
you.
to our committee secretary, thank you. Broadcast. Was there anyone else in support on Senate Bill 171?
If you would like to testify in support on SB 171, please press star 9 now to take your place in the queue. Chair, you have no more callers wishing to testify in support at this time.
All right. Thank you so much. We can take up to 2 callers to testify in opposition on Senate Bill 171. Is there anyone else in queue?
If you would like to testify in opposition of SB 171, please press star 9 now to take your place in the queue.
Barry Johnston, Las Vegas, BERRYJOHNSTON. Nevada keeps rewriting its laws in ways that makes healthcare less safe, more politicized, and more dangerous for both patients and providers. This is the latest example of that trend. This bill protects out-of-state doctors who are under investigation or even facing discipline elsewhere just because their actions align with a political narrative. Instead of raising standards for care, we are lowering the bar, saying, come to Nevada, we'll cover for you. Why are we importing doctors who are failing in other states? Shouldn't Nevada aim for excellence, not become a dumping ground for rejected providers and student doctors who kill people like my mom? There's no mention in this bill of the financial impact of the malpractice insurance. Let's be honest, if we're granting illegal immunity to high-risk providers, especially involving minors, malpractice premiums will skyrocket for everyone else. That cost doesn't get absorbed quietly. It gets passed down to good doctors and everyday patients who will move. Just like when you lowered the rate of pay for all the doctors and half of my doctors left. And they specifically said, it's your fault. This isn't about health, it's about politics. We are turning our healthcare into a refuge for controversial experimental treatments that while real Nevadans struggle to access basic care. And in my opinion, the chair constantly misrepresents facts and silences public oppositions, not on just this bill, but across the board. If suppressing speech and shielding bad actors isn't political, then what is? If others are expected to face consequences for what the state considers wrongdoing, is the chair going to turn herself in? Because you do it too. Have a great day.
Well, Mr. Johnson, we're all kind of touched that you like to come and join us in Commerce and Labor and join the other committees throughout the building every day. With that said, BPS, is there anyone else on the lines?
Chair, you have no more callers at this time.
All right. Would you like to make a closing statement on Senate Bill 171?
Thank you, Chair. James Orangeville, State Senate District 21. Thank you for hearing Senate Bill 171. Senate Bill 171, just to reaffirm, does not change what is legal medical care in Nevada. Doesn't change that one bit. What it does do, and what it will do if it's passed, will protect healthcare providers, will protect patients and their families for seeking legal medical care in Nevada. Unfortunately, I believe much of the opposition testimony was misinformed. We did not hear from any healthcare provider opposing this bill, and certainly the language in Section 2 regarding extradition mirrors language already in the Nevada revised statutes regarding reproductive care that was passed by this body, signed into law by the governor 2 years ago. So I certainly stand by its constitutionality. With your permission, Chair Pizzina, if I could allow Mr. Wade from Silver State Equality to also make some closing comments.
Andre Wade, Silver State Equality for the record. In short, just want to ditto Senator Orangeville, but want to thank you all for hearing us today and want to thank everyone who called in support, and I thank the folks who called in with concerns. To the senator's point, a lot of the calls were just misinformed and had a misunderstanding about the law, but we are happy to have conversations with folks to clarify things. And this bill doesn't have anything to do with federal law, and this bill is very similar to what was passed and signed into law around reproductive care and providing protections for those providers, and there have not been any issues. Again, we are just here to provide protections for providers and those seeking care here in Nevada. This has nothing to do absolutely about lowering standards for the providers here in Nevada. But thank you all again.
Thank you both so much. And with that, we will close the hearing on Senate Bill 171, and that will bring us to our final item on the agenda. I know some of you at 8 a.m. never thought this moment would come, but we'll now start with public comment. Members of the public may provide public comment in person, by phone, or submit written public comment to the committee's email. Instructions for providing public comment may be found on the agenda, including the call-in information. We ask that you keep your comments to 2 minutes and please avoid repetition of comments made by previous speakers. Clearly do state and spell your name for the record. We also remind you that public comment in regards to the bills, testimony in regards to the bills is over. So this is just general public comments. And with that, we'll start in our physical locations. And seeing no one coming forward in Carson City, or I believe right now in Las Vegas broadcast, we will move to the phones. Thank you so much.
If you would like to provide public comment, please press star 9 now to take your place in the queue.
Hello, my name is Michael Ryan. I'm a longtime resident of Nevada and a Marine Corps veteran. I had the pleasure of attending the rally on protecting women's sports on Friday, March 14th, 2025. I am very proud of Lieutenant Governor Stavros Anthony's strong leadership and support in protecting women's sports in Nevada. Now it's your turn to do the same. Protecting women's sports is a no-brainer. You are born a biological male or a biological female. If you are blessed with God-given ability to compete in sports at a high level, then you compete against biological males or biological females based on your God-given gender. Enough of this pathetic nonsense of granting a biological male permission to compete against biological females. This is wrong. It is disgusting that Democrat congressional representatives all voted against the Protection of Women and Girls in Sports Act of 2025. I can only guess that they just voted along Democrat party lines, not to upset their congressional leadership. This is insane. Our elected Nevada Democrat congressional representatives in Washington are on the wrong side of history. They very well may not be reelected in 2026 as a result. Don't make the same mistake. Stop allowing biological males in biological females' locker rooms. This is so disrespectful to biological females and places them in a very hostile environment. You have the power to stop it. Do so. Stand up to protect women's sports in Nevada by bringing SB 112 and AB 240 to the floor for a hearing. This is what your constituents in Nevada want. This is what America wants. Thank you.
Hello, my name is Lorena Biasotti. Speaking for myself, I am calling to state that the person monitoring the calls should never be allowed to taint testimony by adding a disclaimer warning of misinformation in between calls of opposition. This is a way of undermining and discrediting testimony you personally don't agree with. This conduct is shameful. I urge you to stay unbiased and treat all callers with the same respect. Thank you and have a good day.
Thank you so much for your comment. I would add that I did let calls go on when there were misstatements, and I'm certainly not planning to call them on a civil action, although they would be guilty of a misdemeanor. And it is important that we do understand the rules and can be respectful and civil as we debate each other. And I thank you so much for your call. It's very much appreciated, and we'll move on to the next caller.
Caller with the last 3 digits of 225, please press star 6 to unmute yourself. Thank you. Please continue.
Hi, my name is Katrin Ivanov, Ivanoff, aka Mrs. Fixit. And I wanted to say that I've been listening to the sessions in 23 as much as I could. given that I have a job and teenagers, and I've been listening now. And what really struck me is that I was under the impression that you're supposed to make bills to make Nevadans' life better and to affect Nevadans' life. However, more and more I hear bills that has nothing to do with Nevadans. You're trying to protect people from other states, what they did in other states, or this should not be ever qualify as a bill to step on the floor. And I'm not talking about a specific bill today. I'm talking about bills from 23rd session and this session, because I listen to other sessions too that they have similar bills. And it just makes no sense to me that Nevada legislatures care more to protect people that live in other states. I don't know if other state legislatures do that, but if they do, they also should be abolished for that. This is, I don't know the exact word, but they should not be doing that. The state legislature should take care of the state residents. They should not care about other state residents more than Nevadans. So I hope you fix that in the future. I don't know if you will. Hopefully you guys take a note of what we're saying. It doesn't feel like you do. Also wanted to acknowledge that I'm very happy that President Trump dismantled the Department of Education, and I hope you're happy because now it comes to the states and we can have more control over those things. Thank you so much and have a lovely day.
Is it my turn?
Yes, please proceed and thank you.
Okay, as Tim Underwood, board member of Moms for Liberty, I have no fear of perjury or any misdemeanor. I have freedom of speech and the right to redress my government any way I want to. Back to the CAST report, they found very little evidence that puberty blockers and hormone therapies for young people actually help them. Also, there's a lack of long-term data they found on such therapies' effects on mental health, cognitive development, and overall well-being. Many young people seeking these services have comorbidities like mental health challenges, autism, same-sex attraction, or psychological issues that go untreated. SB 171 perpetuates physical and psychological harm on minor children and vulnerable adults. It also prevents people identifying as trans from seeking justice in the future from malpractice by physicians or surgeons. Then there's the federal government backlash to consider. The state of Nevada stands to lose hundreds of thousands.
Sir, thank you so much. We did
millions
just
of-
have testimony on Senate Bill 171, but we'd love to hear for the remainder of your 2 minutes any other comments you'd make on other legislation or in public comment in general.
I can talk about anything I want. In federal funding, if we continue to enact laws that defy executive orders, federal laws, and guidelines. For the sake of the children and vulnerable adults in Nevada's budget, and considering that only 20% of the voting population approves of such radical and controversial child castrations, I ask that you strike down this bill and do not let it leave this committee. Thank you.
Thank you. Again, a reminder, we really enjoy hearing your public comment. We really enjoy hearing your testimony. We just ask that you actually raise your hand and speak in testimony when it's when it's pertaining to a specific bill that we've discussed in committee. And then after that bill session has closed, after that bill hearing is closed, then we move to public comment where we look forward to hearing your general comment. And with that, I believe we have one more caller.
Chair, it looks like they no longer wish to provide testimony.
Okay. Well, thank you so much.
Oh, I'm sorry, I didn't unmute. No, I'm here. Hello?
Yep, please
I'm
proceed.
here. Sorry. My phone. Barry Johnston, Las Vegas. Madam Chair, thank you for your sarcastic remarks about my presence every day. I love it. Let me remind you, I don't work for you, you work for me. We, the people, have a duty, not a choice, to keep the public servants in check. And based on what I've witnessed here, you need the constant supervision. I don't have the time to be here every day. I run a business, I have a family, but I show up because body is out of control. Last session, you destroyed Nevada. We are less safe, we are more divided, and Nevada is now living under a fear of authoritarian enforcement from unelected bureaucrats and trend-chasing lawmakers. Our economy is struggling, energy costs are up, and crime is rising. Meanwhile, this legislature is wasting precious time following social media trends, pushing out bills that serve political narratives, not the people who live here. You're not solving real problems. You're virtue signaling. While families are being crushed by inflation, bad schools, shrinking free zones. And I have to ask, where are the state attorneys? Why aren't they holding this legislature accountable? Who's keeping you in line? Because where from I'm standing, it looks like this body has abandoned its oath, ignored its constitutional limits, and has turned into political circus. I didn't come here for your approval. I came here for because liberty requires vigilance. And based on what I've seen, you've earned none of my trust. Have a great day.
Thank you so much. We appreciate all of our callers and public comment, as well as throughout the entirety of this. And again, this is the people's house, so we appreciate all comments. And I certainly hope no one takes that as sarcastic, because we genuinely appreciate everyone's comments. And as some of our speakers have shared, we absolutely work for the people of Nevada. This is the people's house, and we look forward to serving you. With that, BPS, I believe that was the last caller. Is that correct?
Yes, Chair, you have no more callers at this time.
Okay, after a marathon meeting, I thank all of the members, all of the staff, everyone who's worked so hard. Thank you so much. We wish you all a wonderful Friday and weekend, and we will come back on Monday, the 24th at 8 a.m.